Okay. Good evening. Good evening. We'll get started in just a couple of minutes. We know that there's some folks that are just now getting here and parking. The weather's been a little bit bad. So if you give us maybe 2 or 3 more minutes, we'll get started. And we've got a lot of great information to share with you, a lot of new information. So hang on. Thanks so much. Yeah. Do you guys know each other yet? Oh, no. Oh, yeah. Well, we merged. Really? With who? Yeah, we went public. I forgot. Yes. That's okay. We went public. Awesome. Yeah. So we have a lot of capital. And we're just doing fantastic. We're doing really well. We're looking at really being aggressive and growing our footprint. So we're really excited about that. Just because you're in South Carolina, we're in the southeast, so we're like North Florida, Mid Florida. Because I know it's about Tampa. Yeah, we like. Yeah, I mean, it depending on it would have to be a referral source versus we're gonna go heavy with marketing and silo marketing and digital and non-digital and really hit hard certain geographical areas. So this is kind of one of those things that we're just, if it's a referral and it's outside of our typical Southeast footprint, then we have clients in Arkansas, we have them in Kansas, we have them in California, Hawaii, we have one in Hawaii, we have Alaska, we have them all over. So it's just a matter of who refers them to us. We're a little picky. We have top-notch clients. You know, I know. Yeah, a lot of the companies is the big banks because their business model is that. We have like yeah, the guys. Now you have another new person, right? I haven't really gotten any here, but it's always good for us to see and hear everything, and then I'll just do my touch points after, right? Does she handle? So, what is the? Yes, but Brianna's gonna introduce us, and you're just gonna say hi. Oh, you're going to go through all that? Don't you want to know? Oh, I mean, I don't know. Do you have time for that? Usually, I know. I think she doesn't know you guys, so you have to. And I don't know the cable. On. Good evening. Let's get started. Thank you, everyone, for coming this evening on this beautiful night, trekking it all the way to North Charleston. It's a pleasure to get to see all of you, and I just wanted to take a minute before we get started and before I have an opportunity to introduce Linda Harvey. I'm Mandy Harrison with Patterson Dental. It's awesome to see so many familiar faces. And real quick, I'm just going to make a quick introduction and say thank you to our vendor partners that are here
helping sponsor the night and make this possible.
I'm Liz with Affinity Bank.
Erica with Coltine Sycan.
Donna Helatis with Crosstex.
Mark Wilkerson with Cabo Kerr.
Rob Olenchek with Hugh Freedy.
And Drew Barbash with Cabo Kerr.
And I think the whole Patterson team is still out in the lobby, but I really wanted to thank our entire team. They worked really hard to organize all of this and get the food and get everything set up. So I'm very grateful for them and everything they do each and every day. How many of you have had the opportunity to hear Linda Harvey speak in the past? Just by show of hands, I'm curious. Awesome. We are delighted to have you. Linda traveled here all the way from Jacksonville, Florida to speak with us. And just real quick, I wanted to let you know that Linda is the founder and CEO of 2 compliance-related companies. Her newest company, the Institute for Dental Compliance and Risk Management, was founded 4 years ago. The Institute teaches dental professionals how to become compliance experts. Linda was honored to serve as a subject matter consultant for the ADA on 2 separate occasions. She is a licensed healthcare risk manager and veteran dental professional. Today, her goal is to help you protect your patients, your practices, and yourselves by achieving optimum compliance in your office. So thank you. Thank you for being here.
Thank you.
As you get ready and run a crazy busy practice on any given day, isn't this how you feel right here? It feels like the phone is ringing off the hook and you're checking in and out 1 million patients, or so it feels like. And all along the way, we have to be sure that we're maintaining HIPAA compliance and patient privacy. So we know that every time we enter an updated health history, for example, the information in that computer has to be kept secure so that only authorized individuals have access to that information. When you're filing that insurance claim form, it has to be transmitted in an electronically secure way. Come on in, we're all fine. Come on in and join us. And then when patients come to the front, or you get calls or emails or letters for release of information, we have to ensure that that information that we want to release to the person who's requesting it is supposed to be released. So how do we manage a crazy busy day with compliance related to HIPAA? So tonight I'd like to lead off with our HIPAA course and then go right into OSHA and infection control. And I have a lot of new information to share with you, new things, not so much new things with the laws, but new interpretation as far as what's happening in our world of technology, and actually what's happening in the world of dentistry related to HIPAA, infection control, and OSHA. And likewise with Mandy, I want to thank all of our partner sponsors that were here tonight. And I think many of you had a chance to go by and visit them and pick up some samples. So please do so as you're on your way out tonight, or if we're talking about a particular topic and I say, so-and-so's out there, or a couple people are out there. If somebody from your office wants to slip out and pick up some information in between times, that's great. I'm perfectly fine for a little bit of movement. Does that sound okay to you all? Okay, good. So 3 things that I'd like to address tonight in our privacy and security section is, first, I want to tell you about some actual breaches that have happened to practices and see if these are something that could happen in your practice as well. And then what were the lessons that could be learned from that? And likewise, we'll talk about the security regulations. Oh boy, insider threats, outsider threats. What's going on with the Windows EOL end of life? And then last but not least, let's make sure that you have your compliance plan in place. Everybody should have 2 handouts, the OSHA handout and the HIPAA handout. So we're going to go off the 2-page OSHA one first. Pardon me, 2-page HIPAA one, I misspoke. So this is just some key information there. The information on your HIPAA handout does not match the slides. It's ancillary information. As always, you are welcome to take any pictures of the slides that you like. I invite you to do that. That's perfectly fine. As we begin our conversation on privacy and security tonight, we're going to begin with a conversation about 2 practices and talk about the tale of what happened between 2 different practices with 2 entirely different kind of outcomes, and see where you might fall on this spectrum. When we look at this, we have a reactive office and we have a proactive office. And the reactive office, there were some patient files stored in the cloud that ended up not being secure, while the proactive office had terminated an employee who took patient information on a flash drive. And so as we talk about that, I want to mention something that's kind of on my mind right now, because just earlier this week, I had the honor of working with some new clients in Connecticut. If you think it's cold here, all right, let me tell you. I know I'm not in Florida anymore, but it's not Connecticut either. So that being said, I noticed that as I was wrapping up my day with them, they were going to be finishing with a team meeting. So I'm doing some things back in the break room, cleaning up my information, organizing myself before I say goodbye. And I'm looking at their agenda for the day. And one of the things on their agenda was the fact that a new hygienist had brought over 2 patients from her former office. So yeah. So before I left, I called the head of operations out of the meeting as before I said goodbye to everybody. I said, can I just share something with you? I said, I know this feels like a good thing. You have a new employee and they're bringing in new patients. That's pretty cool. But think about the office that this came from. Is this hygienist stealing patients from another practice where she used to work? So when we talk about patient data and patient information, I'd just like to bring that to your attention, because sometimes we may not realize when that's happening, and things happen before it happens before we realize it. Let's just say that. So when we look at the reactive office, what happened to them and what was some of the background with their situation? They had contracted with a vendor to provide transcription services. So in full disclosure, I will tell you that these are 2 medical practices. I have plenty of dental examples going forward, but this could be any office. When you think about the type of services that they're using in these examples, it totally relates to us in dentistry. Although we're not using a transcription service overseas, there are other companies that we work with in dentistry that do have employees and departments and whole branches overseas, such as offshore coding and billing companies, for example. So these recordings from these doctors' transcription was uploaded to a folder that was maintained by this third-party company. The breach happened because these transcription files were not kept encrypted like they should have been according to our federal HIPAA laws. Anybody outside the realm of the United States borders is not obligated to follow HIPAA. However, if we choose to do business with companies outside of our borders, we have the obligation to make sure that they are HIPAA compliant, or else we really shouldn't be working with them, because like this company, they become a liability for you. So what happened was they had a patient in this practice who had some very severe identity theft. And she was one of those folks that when she did, she was constantly searching for her name online and making sure if she saw anything out there in the public domain. One day she was searching herself and came up with all of these medical records about herself and hundreds of other patients. So when she found these and they went through the discovery to find out what happened, they realized that this information had been in the public domain for like 7 years, something really a long time. And you know what happens with Google? Although Google doesn't tell us all of their processes, but after a certain period of time, when information is available like that, it becomes indexed by Google and you can search it. So it could have been searched if anybody knew how to search for it. So that was a total reactive case, like, oh my gosh, what happened here, right? So let's talk about our proactive office and begin to look at some of the differences in these 2. This is a small practice as well. They were both small practices. These were not mega medical groups that we think of. These were small practices with just a couple of physicians. And this practice had terminated a provider. And during the length of her employment, I believe she was a nurse practitioner, she had access to patient records, much like any one of you all in the realm of your employment. And she had role-based access. I mean, according to her role in the practice, she was able to do certain things in their computer system. One of the things that she was allowed to do was have a printout of her patients so she could keep in touch with them regarding, calling them about their services, like it's time to have your diabetes education, or it's time to learn about a new service that we have. So things that were totally within the realm of her purview. For us in dentistry, what that might mean is like a hygienist could say, oh, I need a copy of my patients because I'm going to call them for recare, make sure they're staying on track. That's a perfectly legitimate reason, right? So what happened was when she was terminated, she ended up taking that list of patient information and a flash drive with patient information that she was not entitled to take. And many times over the years, I've heard stories about team members, and I know I'm picking, as a hygienist, I don't mean to be picking on a hygienist, but I hear that time and again from hygienists, assistants, and front office team members that leave, and then they solicit patients to their new practice, go so far as to go online and Facebook and wherever and post negative things about their former employer, and really put themselves kind of in jeopardy. This was a case, I believe, where this nurse practitioner ended up getting disciplined by the nursing board in New York where she practiced. So let's talk a little bit more about the business associate side of this with the reactive office. I mentioned that they were overseas, so they legally weren't bound to our HIPAA laws, but this company probably had chosen them based on pricing for transcription services and did not do enough due diligence to make sure that they have a business associate agreement. So I will share with you that myself and some other HIPAA consultants are working in the realm of now looking at your business associates. When we work with clients, we're going further. We're asking your IT company to fill out a vendor form to make sure that they are HIPAA compliant, because business associates under the federal law have to follow almost everything that you all do, doctors, in your office. They have to have a security risk analysis. They have to have policies and procedures. They have to secure your data. And they have to have team training for themselves and their employees. So when we talk to companies like, and I'll just call out one, Weave, sometimes they are helpful in giving us their business associate information or letting us know that they are compliant, because sometimes some of these business associates that you're working with are doing this. They feel like they are not required to follow HIPAA. So please take time and call them to task, because otherwise your information is jeopardized. And if you know your business associates are not compliant, then you're responsible in the end for that liability if something happens, if data is breached. In this particular reactive office case, they were in bad shape when it comes to HIPAA. They did not have any current compliance policies. They had no security officer. They had no training, no IT infrastructure. They were in a world of hurt. So this didn't look too good for them. So if I could just look at your HIPAA handout for just a moment. So what you'll see on your handout tonight then is not just on the front here, a high-level list of some checklists for you, but on the back, for those of you, and I'm happy to see so many familiar faces. Thank you for being back, and welcome to everybody who's new. But for those of you that have seen this form before, this form has now been revised. So when you take time to go through this form, if you have a lot of no's or I don't knows, that means that's your homework to go back and determine what those are the steps to take to help elevate the compliance level of your practice. Now with our proactive office, on the other hand, this practitioner did, while she was employed with the practice, have role-based access. So she was entitled to have the information that she had access to. She just wasn't entitled to take it with her. She'd received HIPAA training. She even signed the confidentiality and non-disclosure agreement, for crying out loud. And unlike the reactive office, this office had a privacy and security officer. They had the risk analysis that was current. They had policies and procedures, regular staff training, and a good IT company that was looking out for them. To further contrast between these two, the proactive office got their case settled with the Office of Civil Rights in about 6 months, whereas the reactive office, look at that, 31 months. And I don't know however you cut the calendar, that probably involved 2 different holiday sessions. Can you imagine going out for your Christmas break with your nails biting, thinking the Office of Civil Rights is going to be contacting me for more information? Because that office had to work double time to get compliant and to respond to the questions and requests for information from the Office of Civil Rights. You may recall that in the past we've talked about the fact that the Office of Civil Rights is the HIPAA police. They're the federal arm of the federal government that does the investigation, levies the fines, and makes sure that we're all staying compliant. Now I'd like to share with you some dental-specific examples. Are you aware of the fact that if you do a quick search and use the terms HHS Wall of Shame, you'll come up with a link to take you to the portal where all the active breaches that are being filed in the past 2 years are being currently worked? This is public domain, and forgive me, I don't remember in your state. I know a lot of states, disciplinary actions against the doctors and hygienists or even assistants are in the public domain. So this is in the public domain as well. So I did a quick search about a month ago just using the term dental, and these are the ones that came up. There's about 12 or 13. There could be more, but I just took a quick search. Now, I purposefully cut off the names because I didn't think that was relevant to our conversation this evening. But when you look at that, take a look. This was relevant to me when I first published it because it's like case number 4 and 5 are Florida. It just so happened that in this top 12, there was none from South Carolina, but I know you've had some issues in your state as well. But over at the far right, look at how many involved the network server, how many of them involve desktop computers and email. So it's all electronic. There are some paper-based issues. I did see something come across my desk in a newsletter recently where somebody had thrown paper records in the dumpster again. Accidents happen. But for the most part, a lot of things that are happening now are electronically related. So doctors, if I can just speak to you for a minute, making sure that you have a company that provides managed services, MPS, managed provider service, is really important, because if you're using an IT company or IT person rather that you know and trust, but they're only providing you break, I fix services, then you're probably not as protected as well as you think you should be. And I could tell you story after story about some of those situations. So let's go drill down then into some tips for HIPAA proofing and see if you have any questions so far. Questions on our two practices, reactive and proactive? So the hot topics that I thought it would be interesting to address tonight would be social media, because we all live on social media. We took some pictures today. We'll put them up there and thank our Patterson team and everyone for being here. And I know that's a great tool for growing your practice as well. And then let's drill down and talk about network issues, insider threats and the outside threats. This is an interesting case. I don't know if you saw this on one of the news wires, but a few weeks ago, maybe when was this? October, beg your pardon, last month. This dental practice in Texas went from putting responding to a review on Yelp that went to yikes, and it cost them $10,000. I happen to know the consultant that got called in to work with them, and from what he told me, he was surprised their fine was so low. They were very much like the reactive office that we just talked about. No policies, procedures, no training, no security risk analysis, no good IT, and they got busted. They got busted because they do what we all do all the time. How many of you have ever received a negative review on Facebook or Yelp or wherever, and you feel like you want to say something about it? Because it's personal, isn't it? I would take it personal too when someone's not happy. Because I know I do. I always want to know, how are we doing tonight? How's everybody doing? Are we all working on the same page? Is there anything I could tell you differently or talk about something so we can make sure everybody's ideas are met tonight and we're discussed everything? So we can't just go back there and talk about all these types of things on social media, because then it gets you into trouble with the federal government. How many times, this is honest truth now, how many times have you had anybody say something about you on Facebook and they weren't even a patient of yours? Does that happen to anybody? Yeah. And you want to go, where did this person come from? What do you mean we didn't answer the phone? Or I was running late for an appointment. You never walked through my doors. It's like, so it happens, I know. So just be very, very judicious in what you say. And what happened in this case, they actually divulged a lot of patient information. They divulged the patient's last name, they put in treatment plan information, insurance, and the treatment cost. See what happens when you get emotionally involved? We're able to just kind of cross the line and not have clear thinking. As a matter of fact, from what I understand, this was not the first time that they refuted a negative review on Yelp. This was just the first time they got reported for doing so. Even divulging that somebody's a patient in your practice could make a difference. So please be very careful. It's one thing when the patients post something on your work page, Facebook, your office Facebook page, you want them to give you the good reviews. You want them to solicit it. You solicit that for they can give it to you. But we can't take a picture of a patient and post information about, here's our no cavity club. Oh, look, this person said, loves our smiles or whatever it is, without the patient signing a proper HIPAA compliant authorization form. And this is not a photo release form that you're not going to owe them any money for marketing or pay them for the form or the picture or anything like that. That can be on a HIPAA compliant form, but it has to be a HIPAA compliant form. Questions about anything on the checklist? Questions about policies, procedures, anything? Until we go into some computer stuff? Okay. How are you feeling? This is always the overwhelming part, right? True. I understand. So if I use a term that, that I don't describe or that you're not familiar with, please do stop me. Because sometimes I hang out with these techie people and I start speaking like them and I don't even realize it. All right, so let's look like these. Let's go back and look at this. These are some real life pictures that I borrowed from an IT company that they find in offices that please go back and make sure your server is not about to crash or do something totally crazy on you. So this is one that's, well, let's look at the dust there. It's probably going to blow up because it's going to get overheated. This is one at the top. See the red circle at the top? I probably should make that a little bigger. That's a blinking amber light on your server. That means that something's about to go wrong. And what happened was the circle in the lower, the red circle on the bottom, simply means that there was like a drive there that was bad. So keeping your eye out, and that's what a good IT company will do for you, and making sure that your server is working fine is a big deal. If you're cloud-based, I'll make a couple of comments about that in just a moment, which is fine. Doesn't matter whether your system's cloud-based or whether it's server-based. I hope this doesn't look like in your office, right? Now, we do not make this stuff up. This picture is not staged, okay? They should be proud. I don't know how it's working on a wing and a prayer. It looks like yours doesn't look like, okay, good. You're safe. Just his desk looks like that right now. So, all right, okay. Let's talk about Windows end of life here, okay? You've probably been hearing all the stories. You've been hearing it from Patterson probably and your IT company and all the other vendors that you work with, that if you're working off of Windows 7, Microsoft is not going to be supporting Windows 7 after January 2020. That's old news now. And the reason that that puts you out of compliance is because once Microsoft stops issuing security patches, now there's nobody to support your operating system and keep it secure according to the HIPAA guidelines. So that's why not keeping up with these updates puts you out of HIPAA compliance, and it puts your practice in jeopardy because now you become more vulnerable as an easier target for some of these ransomware and hacks that go on. We have a client in North Florida that we've been working with a very long time, and their IT person isn't always the easiest to work with because he's not very responsive to them, the client, or to me when I need information. They got ransomware last month. And by the third day, when they're telling me that EagleSoft is scrubbing the data, I'm thinking this fellow didn't have a bona fide backup for them. We have another client that we just uncovered the fact that their backups are only around for about 14 days, and then I think IT is saving over them. Well, guess what? If you get some kind of ransomware or malware, it could live on your computer system for a couple of hundred days before it launches. So if the IT company is only saving your backup, a full disk backup, for 2 weeks, now you have no backups that are not infected. So what do you do but have to pay the ransom, right? So our client in Florida, the ransom that the hacker wanted was 5 Bitcoins. Now you probably are aware a Bitcoin is virtual currency. You know, it's not paper stuff anymore. And they're probably worth about $8,000 a Bitcoin, and they wanted 5. So $40,000 doesn't seem like a lot of ransomware because you go to the movies and you watch, you know, hijacking and abductions, and they want millions of dollars for these people, right? They only want $40,000. But to respond to how you should respond to any kind of ransomware or hacking, you have to go back and take a look at what the Office of Civil Rights says in their guidance document. I know some IT companies that are saving Bitcoins just for their clients with this situation. But if the IT company pays the Bitcoins, gets your data back because they don't have a good backup, and you don't do the right report or the right forensics on that machine by a third party, if your data shows up on the dark web and it's sold, and the Office of Civil Rights or the FBI or the Federal Trade Commission finds it first, now we're even more of a trouble, right? So one of the things we have to prove is that that data was not accessed or what's called exfiltrated, meaning someone didn't take data out of the server. In this case, sadly, my client let his IT person run his own forensics. So he had no objective third party that was really looking out for him, right? Does that make sense? Okay. So looking out for a good company is very important. We just talked about upgrading the Microsoft. And by the way, by January of 2023, Windows 8 is not going to be supported. So that's why everybody's saying go to 10 now and just upgrade. So what we're recommending to our clients and to other consultants is that you budget between 1% and 2% of your budget doctors for your just compliance in general, whether it's IT or you need someone to help you with HR or OSHA or whatever aspect you need, then you have something in the budget. Let's say a couple words about passwords. Does anybody know what the most common password is? Password 123. Right? Yay. All right, so I must have told you that last year. Is that the answer? No. But good job. That's your password, right? So please know, I think EagleSoft only lets you have 8 passwords, 8 characters, right? Am I right? Okay, that's right. So thank you. So that's not very many. However, that's like your bottom password. You've got your Windows password and all the different levels with your server and your firewall. Make sure that those are extremely secure, meaning like 15 characters or longer. The more secure that you make a password, the less likely it is to be hacked. There are statistics that can show us that the longer the password is, the longer it's going to take or how many years it can take for it to be hacked. An 8-character password can be hacked just in almost, within a few seconds. There's a lot of free software. So anybody that needs a moonlighting job, check out the free software for hacking, okay? I'm just teasing you all on that. Okay. Have you dealt with encryption in your practices? Full disk encryption. I know you can encrypt your EagleSoft database, but guess what? You have a lot of other information living on your server, don't you? You may have HR files there, and even though employee records are not bound by HIPAA, you still want them to be secure and private. You have your Word documents, you have anything else that you've scanned in, you have letters that sent to the GP, you've got all kinds of things on your server. So that whole disk needs to be encrypted. Let's take a couple moments and talk about who has access to your patient data, okay? I said a few words about business associates. Those are individuals or companies who create, maintain, transmit, or receive your information. Now, in my world, like when I do infection control or compliance consulting, unless I'm doing a patient records audit, I'm not a business associate. So even if when I am, I'm not necessarily creating, maintaining, storing, but I'm accessing patient information. And then I'm going to give it back to you because I don't want to take it home either. Right? So it's very important that we know who has your data, and we mentioned having the business associate agreements in place. So folks that I'm asking to look at now, and I've got some examples here, are your webmaster. Do we have contact forms on your data on your website, right? So here's something that I never thought of since I saw you last time. This is something that dawned on me with some of our consultants and other experts that we work with. The privacy rule defines an individual, which is who we reference a patient in our world, as we have to protect their past, present, and future information, health information, and their past, present, and future payment information. So when you talk about the word future, we're referencing future patients. So when a new patient is filling out, a new prospective patient is filling out information on your website, that information, that contact form should come to you in a secure fashion. And likewise, we have more clients that are using the pop-up text window. I don't know if anybody's using that on your website, like Zendesk or some of the other groups. So that person, that company is also a business associate. Because any time somebody can free type in there, they're going to give you a whole lot of information and divulge a lot of data about themselves. Oh my gosh. Note to self, check that out. It's a very cool service where your new patients can find you on the web. They're looking to look for a new dentist in the neighborhood. And if they can schedule an appointment with you right then and there, then you've captured somebody versus waiting for them to call your office on Monday or the next day when you're open, sending out forms, and this whole long process. I have some clients that use LocalMed and really like it, that you give them only certain access to like the new appointments. They don't have access to everything. That's one example. Chat functions, we just talked about that. And then online scheduling. These are just some examples of how we're using companies and how companies are providing more creative services for us in dentistry. So as that piece changes and how we do business, it's incumbent upon us to also keep up with our compliance piece that relates to that. Questions or thoughts on that piece? Yes, sir? A local med, L-O-C-A-L, local med, M-E-D. Yeah. They got bought by Intellident, I think, or Dental Intel, but you'll still be able to find them online. Yeah, thanks for asking. Yeah. So let's talk about insider threats. You know, sometimes unfortunate things happen to good people. We make mistakes or some hiccups happen in our life and day to day, right? So let's talk about internet surfing. So in your day-to-day work on your computers, you know, in the office, please don't use the work computers for personal information and personal accessing. One of my team members went by to check on our client during that first few days when they had their ransomware, and she saw somebody at the front desk actually on Facebook when they shouldn't even been online to begin with. It's like, hello, don't you realize this is a big disaster here? I've never seen your boss so disorganized and unfocused in his whole life, and now you're on the Facebook in front of the office. So we have to be careful. Doctors, you certainly, if you have your guest Wi-Fi, that's the best thing for you all teams to use for if you're not going to surf on your own data plans, use the office guest network, okay? We just never know when something could happen unintentionally. And your IT company should have something called content filtering set up so you can't go to websites anyway that are based in countries that have a high volume of ransomware and hacking and whatnot. Last but not least, please be sure you have a computer, internet, and email policy. And maybe that policy should also include how you're using your phones, as far as taking patient pictures on there, sending patient information, texting patients about their appointments, texting the lab. All that information should be considered compliant if it's encrypted. So please look at that as well. All right. I'm going to take you through a couple of last minute slides, and then we'll go into the whole system with our security role and kind of then go into OSHA in a few minutes. Is that okay? So this kind of, these few wrap up. This section here, this slide tells you what the requirements are for the privacy rule. So when you look at your policies and procedures for privacy and security, I'd like to tell you my story about how I've been looking at them since I saw you all last. Your policies and procedures remind me of our patient records. And thinking about when we were all back in school and when I was a baby hygienist, what did we learn about your patient records? What's one truism that you can think of? How about if it's not written, it didn't happen, thank you. If it's not written, it didn't. So if you don't have customized policies and procedures in your practice, then you're not compliant, right? Okay. And then another thing we learned about our record keeping was in the day of paper records in particular, which is what I kind of cut my teeth on, right? Was how do we amend a record? How do we make a correction? So we did one strike through, maybe we would initial it, but we didn't black it out, we didn't use whiteout, and we didn't tear up the piece of the chart and start and write the whole thing over again, right? There were some specific ways. So when you think about your policies and procedures for compliance, whether it's OSHA, HIPAA, HR, anything, coding and billing policies, if you're using a fill-in-the-blank product or manual, so when it's time to go back and update that, how do you do that? Because if you're changing a person's name, you're changing a product, you're updating a process, are you whiting it out? Are you erasing it? Are you whiting over the policies that you had in place that show your compliance history? This is if you were showing your patient history. Does that make sense? So I'm really passionate about that and sharing that thought with you, so I hope that resonates with you too. Personnel designation means that you have a privacy officer. So many times I see it's the front office team. Do we have any office managers here tonight? Maybe you're the privacy officer, and he's like, what am I supposed to do here? Policies and procedures on training and sanction, how you safeguard and mitigate the information for the patient's privacy, how do you handle complaints from patients, and how the fact that we're not allowed to retaliate against them. And then, of course, we mentioned the documentation. The federal guidelines tell us that we have to keep all of our HIPAA documentation for 6 years. So if you've been working with a vendor, you may recall that back when 2009 and 2012, we talked about the HITECH Act and the Omnibus Rule being passed. So at that time, you were required to update your notice of privacy practices and to update all your business associate agreements. So if you've been working with a company, say your IT company, for a long time, you should have the business associate agreement prior to 2012, and you should have one after 2012. Of course, now it's been more than 6 years, so you may not need to say, but that being said, anytime you sign a contract with anybody new that's a business associate or meets that definition of a business associate, please be sure you get those business associate agreements signed at the time of that contract and not 6 months or a year later. Otherwise, you have this gap in your compliance that shows that you shared data with them and you did not ensure that they were compliant. Okay. Questions or thoughts on the privacy rule? I think the biggest conundrum here is who can you talk to, right? And release information to. Any questions on that? Anybody have challenges handling when parents are divorced? That's a hard one in your office. Anybody else share that question about parents that are, how to talk to parents? Nobody? Okay, all right. Thank you. So let's chat about that for a minute then, okay? And I don't know the state laws here. My assumption would be, and we know what to say about assumptions, right? And I'm not an attorney either. I'm only a little risk manager. Is that more than likely you would have a situation where, unless the parental rights are terminated, both parents have a right to have access to the information. So you can verify that with the South Carolina Dental Association or call your local attorney to make sure that's correct. But sometimes what happens is mom brings the child in or children in and maybe lists grandma as the emergency person and never lists dad. And then at some point down the road, you've got this gentleman calling, hey, my kids have got this work done. I don't know what's going on. I'm getting this bill because, you know, the divorce decree says he's going to pay, right? But he's not listed anywhere. So please just say, sir, help me help you. Can you help me with some information so I can better help you? You don't have to divulge anything just yet. Let's identify who this person is to make sure they're actually who they say they are. And do so carefully without getting drawn into the family drama as much as you can help it, okay? We have a client in Florida, pediatric client, and this happened earlier this year with them. They're always calling me about something because the world of peds is really unique, isn't it? And I worked in pediatric medicine, which you may not know, for 13 years, so I totally understand it. So they got a call one day from a father about a patient with he wanted some information. And this patient was probably like, you know, getting towards middle teens. I think she was getting like 15, maybe 14, perhaps still young teen. But the patient was inactive, had not been in the practice for several years. And just like I described, at that time when the patient was an active patient, dad was not listed on the record anywhere. And now he's calling because there was an issue that I think the child was missing, or there was something kind of sad going on. And now he's trying to find information. So my client thought very quickly and said, well, sir, help me help you. That's why I said what I said a minute ago. Help me help you. I just need a little bit of information to be sure that I'm releasing to you the right information and that you're the proper person, as you can understand, for the privacy of your child or the security of their information. So now you're kind of bringing that into like, help us work together with you versus we can't talk to you and putting up a brick wall. Does that make sense? Okay. Other thoughts or questions that you have about privacy and release of information?
Well, one is like, one of the issues that we have is like a grandparent will bring the child in, trying to say that there's a legal guardian.
Ah.
And we run into that, so how do you deal with that process?
So we have I see pediatric on your shirt too, yes. So what happens when grandma brings a child in and says they're the legal guardian, and then as the conversation unfolds, you find out they're not. So obviously you cannot treat this patient, and having a very strong policy on that in your office makes a difference. But if they're not telling you up front, then you don't know till you get halfway down the road. And I know this particular pedo practice that I was talking about in Florida, sometimes we'll kind of toss in like, and please tell me your role with the child. Are you the biological mom? And they're kind of tossing it out there in a gentle fashion, like a little gentle push. Are you the biological, you know, which is kind of difficult because we don't know if the patient was adopted even, right? There could be others or has legal guardianship. So yeah, so how you handle it is, I would recommend stopping right then as soon as you find out. But if you don't know, when you go through this whole series of treatment and someone has brought the patient in, you're working on good faith.
Right.
But as soon as you have a situation like that, you may have to, you may want to get legal consult just to be sure they can get kind of, you know, just so it doesn't get confusing with whatever your state laws are. But as soon as you know, my recommendation as a risk manager would be like stop and say, okay, here's how we can help you. This is not emergency. And sometimes when you look at patients' information, in different states, your power of attorney and your legal papers are very different. Like I know in my state, power of attorney may not include healthcare. Might include everything else with finances, right? But not healthcare. So if that's the case here, which probably is very similar, then you just ask them to bring in the documentation. Because this is elective care. It's not like it's an emergency care. Even though the child's, they'd have to go to the ER for the emergency care. Yeah. Good questions, yeah. Let's talk about the security implementation specifications. There are 9 here, and these are the types of things that you would need policies and procedures for. These are not listed in your handout. You're welcome to take a picture of this. Yeah. I see people are getting some phones out, so I'll wait just a second here. Security management means, who's running the show? Who's your IT person? What do you have in place for your security measures, your antivirus? And please never, ever use anything that's free. Free is not worth it. Assigned security responsibility refers to who's the security officer. Doctors, I typically recommend that should be you, because I think ultimately you make all those decisions in the practice, because these are financial decisions now. Upgrading your systems, upgrading your computers, what IT company, this is all budget for you. Workforce security, information and management, security awareness and training. How would you handle a security incident? And what's your contingency plan if something happens to your office? And then an annual evaluation of the program. And then we've already talked about business associates. Questions about security? You've been hearing already about the Windows end of life, right? So you don't have any challenges with that. You kind of have to bite the bullet and step up, right? Other thoughts or questions on security that you might have? No. Okay, we're good. All right. Let's go through these 9 elements of a key element program here, and then we'll switch gears, all right? It's imperative that you not only have staff training annually, but you have documentation and new hire training. And when I show you some class action lawsuits that are happening in OSHA as a result of this kind of thing, or infection control, I should say, then the whole concept trickles over to what the Office of Civil Rights would be expecting as well. The customized policies and procedures that I mentioned to you should be there. Your security risk analysis. This is not just a checklist. I've given you some checklists tonight. That is not a security risk analysis. That's just a brief assessment to say how are you doing in your practice. The Office of Civil Rights has some guidance documented on that. The URLs are super, super long. So what I recommend is if you just use the keywords OCR, security risk analysis guidance, security risk analysis guidance, and it'll bring you to a document you can pull up. It's 9 pages, but it's a good document. We talked about the business associate agreements, making sure you can put your hands on those. You can keep all this information electronic if you're trying to be super paperless and you're really good at that. Otherwise, keep everything in paper. Yeah. But just make sure you know where everything is located. I'd highly recommend, this is something that I started doing recently, is on your team meetings, if you have a little bit of an agenda that you kind of use as a format, just add compliance and safety, because it shows that you have this continuity of compliance in your practice and your culture of safety. It may not be that you're talking about security with HIPAA all the time. There may be a Dr. Bicuspid newsletter if you saw on infection control or safety, something like that you're talking about, what's going on in the neighborhood. Maybe there's some robberies. You want to talk about what we're doing for our security processes. It could be anything that you want it to be, but it shows that you have that compliance. And actually, I left it in the car. We're going to raffle off later a compliance notebook that we have, a quality assurance binder that we're going to, so this is documenting everything here, adding compliance in. So one point that I will leave you with on these now, doctors, please talk to your cyber risk carrier tomorrow, tonight, soon. Here's why. I may have told you before about having cyber risk insurance. It's usually tied to your malpractice insurance. In the past, I typically said, well, just make sure you have a policy, check what your policy limits are, understand what your exclusions and deductions are so you can be prepared in a worst case scenario. We do that with our homeowners. We know that with our car insurance, and we know that when we shop healthcare insurance, right? Now, another thing to add to your radar is be sure that your cyber risk insurance covers forensics. That is one of the biggest expenses that you will have. My breach expert who lives down in Christmas, Florida, is working with a client that has 2 offices and spent probably like $80,000 on theirs. Yeah, that's a nice salary. I could do one of those a year, right? It'd be pretty bad. So it's a lot of work, though. So please check with your carrier about that. As a matter of fact, she's also working with a client in the Midwest somewhere, Missouri or someplace, who was a victim of ransomware. And I'll tell you this story too before we close out this section. And when she went to file the claim, the doctor found out that she had no coverage for forensics, that they would only pay for notifying patients. I mean, she probably was getting some, not paying too much for the premium, so it looked attractive. But now she's stuck with ransomware and got these big issues and has no real support. Back in August, I didn't mention this on any of the slides, is there is, and still in business to this day, a IT company called PerkSoft. I don't know if any of you guys saw that in your newsletters or if anything that you've read. It's spelled P-E-R-C-S-O-F-T. They got ransomware. And they have about 480-something clients, and almost all of their clients got ransomware as well because of their security issues and how they manage things. PerkSoft used their liability insurance to pay the ransomware for all their clients that they needed to, over $2 million. So now they have no coverage when these doctors are all going to sue them for lost time. The statistics show that when a company has a situation like this with ransomware, they're usually out of business in about 6 years, six months. 6 months. So that would apply to anybody, us in dentistry, an IT company, any other kind of business. So when I harp on that tonight, please know that it's just, I wanted to help you kind of look at it a little bit with a different perspective tonight, okay? So as we get ready to change slides in just a minute, I just wanted to share with you that we offer live webinars. This is not a sales pitch, but if you want more training, I just want you to be aware that we can certainly offer you something in that, or security awareness, or if you want to take advantage of the free consult at the bottom of the paper, that's totally up to you. But I just like you to know that we have additional things available if you want to take advantage of those. Although if you want to come to Florida anytime, I'm happy to have you come down and join me in Florida. Should we talk? You know Mandy's the new general manager here, right? Because I know many of you knew her in her former role, right? So should we convince her to y'all to come to Florida next year, right? How do we do that? Do we do a petition or something? I don't know. How do we do this, all right? I'm serious. How do we do this? You would like to come to Florida, right? But you probably want to go further south than just Jacksonville, wouldn't you? If you're coming to Florida, you want to come to the real Florida. You want to go see Mickey? So, doctors, tonight, if you haven't gotten one of our books in the past, I have a book for you tonight. This is just a courtesy with a lot of different chapters from different experts like Paul Homily and other experts on different topics of practice management. So please come by and pick up one. There's no charge. These are our gift. Or if you're here without your doctor and you want to take one back to the office, please feel free to do so. So for those that have been with me the past couple of times, you know that we do our course evaluations on our phone, right? Besides your handout, I'm very dedicated to try and be green in some fashion. Although I'm not wearing any green yet tonight. So tonight I'm going to present you with 2 options. One is going to be this QR code that I'm going to give out to a couple of people on a piece of paper to experiment with. This is not the way you have to do it, but because I don't know yet on a big screen like this, if you try to take a picture of this, I don't know that it will work. Oh, she's going to test it. Did you try it? Oh, sweet. I'm going to throw these papers away. Cool. All right, so it worked. But now it's going to take you to do the course evaluation. You really haven't finished evaluating me. So hopefully you have give me the full evening before you evaluate. Maybe I can redeem myself. So did you have to hold it a certain way, or did it just automatically catch it? Yeah, I knew that. But the distance, the size is okay? That's what I was worried about, because zoom in. Okay. So I should make it a little bigger, you think? Tomorrow I'll make it bigger. Okay. All right. All right. Yeah. Got the magic. So, all right. You guys are doing all right. So you were jumping ahead. Everybody's ahead of the class here. So if you use the QR code, You're good. But let me share with you some challenges that might come up later. And poor Zach will be calling me, so-and-so didn't get their certificate. So let me help you with that tonight, all right? So, okay, taking the picture and doing this course evaluation is only the beginning step. You have to make sure you get your hands on that certificate so that you know you've got it, all right? And when you fill out the form, after you do the survey, you click the button that says next, and then you're going to see that screen that says click here to access and personalize your certificate. That will take you to the form to fill out for your CE certificate. And when you get there, you'll put in your name. You can put in your license number. Doctors, it will ask you for your ADD number if you're an Academy of General Dentistry member. You can put as much information as you want in to customize it. Then it's going to ask you for your email. It's going to ask you for your email. That's not for me to spam you. Please know that. We're all too busy, right? So the email, so that it comes to you in an email. If you don't get the email before you leave here tonight, then if you have a license in this state, take a pink piece of paper with you. Because 6 months from now, when you contact us, there's an administrative fee for providing duplicate copies. So please take a piece of paper with you tonight, either one per office or a couple per office. We've got several, or at least one per licensed person, so that way you have that information, okay? This is the end of your biennium, and you guys do CE broker like we do in Florida, right? So you know all they got to do is push a button in a report, and they can pick out who they're going to audit. And I don't want you to get caught without your certificate, so make sure you can put your hands on that certificate, all right? It only takes a minute or two. You already got started, so I think we're good. So I'm preaching to the choir. As you know, and you heard me talk about good IT companies and some other folks to you, local med and whoever, please know that when I get passionate about these products and tell you about clients that are using them or what I like about a specific benefit or feature of a product, it's not because I have any financial interest with whatever you buy. Yes, I have an honorarium for tonight, and that's it, all right? I just know the good products and good companies, and I want to help you as well. Talk about some trends and topics tonight, and along with that, we'll go over the federal requirements, of course, but I want to talk to you about what's going on with state law and just what's happening with, the standard precautions. So we know that we have some guiding principles in your state. We are all bound by the federal OSHA. You're bound by the Center for Disease Control, Infection Control guidelines for dentistry because they have been adopted as law in your state. So if you use the word recommends or CDC says this or CDC, it's a guideline, really we have to interpret that as looking at it something you have to do. So when we look at regulations that apply to dentistry from the OSHA perspective, we've really only been hitting the tip of the iceberg when we talk about the bloodborne pathogen and the hazard communication standard, number 1 and number 3. Then there's a whole list of other ones here. So please take a picture of this. You may have most of these covered in your manuals, but here in your state, you have radiation laws that you have to have your radiation manual, correct? And you have your radiation safety officer and all that information. So keeping that up to date according to state regs is extremely important. The last two on the right, we haven't talked about a lot. I wasn't talking to you about workplace violence last year. And just yesterday was when I added in lockout, tagout. And I'll explain those as we go along, okay? So first we want to think about who really cares and why do we care about compliance? We know I'm a business owner too, doctor, so I know I've got to put my posters up and I have to have my workers' comp and I have to do certain things as well. It's like, okay, all these burdens, how do we know to keep up with everything? So here's one thing to bear in mind though, because, and this is why I'm going to talk to the team members, to you all tonight, folks, about what you do to help keep the office compliant, because you wouldn't want to be responsible for not doing something properly and then causing a fine to be levied against the practice. Back in 2015, the OSHA fines were only $7,000 a day per fine per violation. But in 16, they changed. There we go. And they increased. I don't know why my thing is being wonky up there, but it'll come up in just a second. Because the federal government decided that many of these federal agencies, OSHA and others, were not keeping up with the times. They weren't keeping their fines in accordance with the cost of living increases, shall we say. So look at the increase that happened here between 2015 and 2016. Ouch, right? So I looked to see if I could find out what the increase would be for 2020, but it wasn't in the public domain. So the fines for OSHA will be going up more than 13,260 per violation per day. The violations kind of come in these categories here when it comes to the type of violation, the serious, other than serious, and the posting requirements are all still 13,000. Failure to abate it, still the same thing, per day beyond the abatement. And then anything that's willful or repeated, the fine jumps up. Please know that if OSHA were to show up on your doorstep to do an unannounced inspection, yes, you have to let them in, but you can say, can you have a seat just a moment? Doctor's in the middle with a patient. I'd like to let them know you're here. We'll be right with you. Kind of be pleasant to them so you can get things started on a good note, right? And then you are allowed to remediate things while they're in the premises. So if they're asking you for a form and you're going to go get your information and bring it to them and you can't find it, you can certainly create a form, but you cannot backdate it ethically and say, here's our form that for the last 5 years of all of our training. If it's not existent, it's not existent. But sometimes there might be something you can update and work on. When you think about now, why do we care about compliance? We care about compliance because there's been a lot of breaches that have resulted in lawsuits that get passed. Number 1 and number 3 and number 6 were all related to oral surgery. So you may say, oh, I'm a pediatric practice. We don't do that kind of same oral surgery. I'm just picking on you. But, we do things differently. We're not oral surgery, practice per se. But other types of practices have been impacted. The pediatric practice, number 4 and 5, dental unit waterline cases. And then coming forward and looking at these, doesn't matter what size or what location. I mean, you see universities are having issues. You're seeing group practices. You're seeing, people in Washington State was a whistleblower case, number 9. We're using the ISOLite device. And they wouldn't listen to the office manager, and she was trying to get them to change. And they only had one doctor who wouldn't change, and he's very adamant about not changing. So they wanted her to appease him, and for him, just put him in the cold sterile to do the wrong thing. Now I'm going to show you about a case that really is going to hit us home, because this is going to drive home some points about where we are with infection control and really kind of, I don't know, maybe inspiring us and motivating us to look at our practices in infection control a little bit differently so that we don't come out and say, well, that's the way we've always done it, or that's the way we learned it in school. And that's fine, but we know that times change. We're not wearing the same clothes we wore when we were in school, are we? We're not using the same phone. I don't have the same car, thank goodness, right? So I'm being a little rhetorical here, maybe a little silly, and I apologize. But we can't use that as a rationale to base on what we're doing in our practices. We need sound science and research and information and what's correct with the laws. So look at this class action lawsuit, will you? And please just take a moment to just look at it. I blacked out the office name just as a courtesy to them. But look at the next to the last sentence there. The dental also was allegedly hiring inexperienced, untrained, unlicensed students, dental assistants, and other employees who were in charge of sterilizing equipment. Who among us has not brought in a dental assisting extern? Did we ever get any training before putting them loose on anything in your office? What kind of training? And I'm not just targeting dental assistants here, but dental hygienists. So we're kind of all in the back together. What kind of office training are we offering to team members when they come on board to make sure they know your equipment and know your processes? One client that we worked with for a little while in Florida, we got called in by their sales rep because they had a situation where they were shorthanded and they brought in a temp. And like twice in the same week, they were almost putting away, or they actually put away unsterilized instruments, but caught it before they were used because somebody wasn't paying attention. Fast-paced practice. Nobody had time to show this temp, what to do, how to look at things. And maybe she was new to dentistry herself and didn't understand. Every sterilizer is a little different. Every office is a little different. So let's look at what needs to be in your OSHA book and then go forward with some things with sterilization and OSHA. So in your OSHA book, wait till I put up all these. We can go ahead and take pictures here. This is a good place to take a picture. These are an example of some of the policies and procedures that you need to have in place for this, all right? The bloodborne pathogen hazard assessment. current copies of these laws, an annual Sharps assessment, your safety data sheet manual into the hazard communication sign. And now, okay, did you know that anybody hear about the case in Tennessee in January? Nobody? Okay. All right. Shh. Around the end of January, beginning of February, it was one day when a small practice, solo practitioner, dental assistant was sitting there working with her doctor, treating a patient. Her soon-to-be ex-husband came into the practice and shot and killed her when they were working on that patient. Then another patient in the practice who happened to be concealed carry shot that man and subdued him until the police came. And then a few months later, there was a case in Virginia where a dentist was shot and killed in his parking lot. And then there was a case where a dental lab had dismissed an employee for whatever reason. The employee came back brandishing a gun in the parking lot. Thankfully, they saw what, the employees saw what was going on, locked the doors, called the police. Thankfully, nothing happened. Tonight is not the night that you'll solve this piece of puzzle, this piece of safety for your practice, but I encourage you to go back at your next team meeting and start talking about active shooters and just workplace violence. So may I be so personal as to say, if you have any changes in your personal life and you have any restraining orders, then you probably should want to let your boss know about that. But that being said, I was talking to a group up in Michigan earlier this year, and they volunteered that they had brought in a police officer to do some active shooter training for them. So here's 2 words to bear in mind, or maybe a couple of words: baseball bats and wasp spray. Okay, evidently I've never used wasp spray, and I probably need some because we have a lot of wasps at our house. But evidently, wasp spray comes out nice, not like bug spray, but wasp spray comes out in a nice long stream, and you can shoot it pretty far because you don't want to get too close to somebody that's got a gun, right? And if they have a gun, you're probably not going to get too close to them anyway because they have the upper hand. Wasp spray is a good defense mechanism, and the baseball bat is defending. Okay, shh. I know these topics are pretty exciting. So this is why I said we're not going to solve it tonight. You're going to have to talk about it in your office because we could spend 2 hours talking about your own workplace safety. If you look at the FEMA website, FEMA, the FEMA website or the Department of Homeland Security, you'll find some active shooter kind of video trainings you can use as a starting ground. And then also, I would look at, when you look at those videos, there's like a couple points to bear in mind. First point is you must have a survival mentality. The second point is to remember these 3 words: run, hide, and fight. That's where the wasp spray and the baseball bat come in. So run, hide, or fight. So when you keep that in mind, have an office meeting, sit down and talk about what your practice could be, what would happen, how would you manage something like that. It's pretty rare that it happens in a dental practice, but we're a microcosm of all society. Okay? And we're going to talk more about lockout, tagout later in the program. So please take a picture of this slide as well. This is not a new slide, but this is a slide that reminds you. So doctors, do we have office managers here tonight too? The office managers? A couple? Yeah, I see some hands go up. Okay. So you may be maintaining employee files, but the employee medical file is different than your personnel file, and this is information that must be in this. So if I was an OSHA inspector coming to your office, I am going to ask you to see some employee files because legally that's what they're going to be doing. They're going to be looking through your employee files to see when was this person hired, when did you train them, was it within the first 10 days of hire, and when did you get they sign their acknowledgement or declination form for hepatitis B? Is that within that same window? And you see the part about keeping it 30 years, right, doctors? So I didn't make that up. The training records, likewise, those have to be kept for 3 years, okay? As well as training documents for new employees. Let's just say a couple words about fire evacuation, fire safety and emergency evacuation. If you have 10 or fewer employees, you're allowed to have an oral fire evacuation plan. But we know for the sake of having corporate memory and passing along information to new employees, it's better to have a written plan because we can forget. And then you simply review it once a year in training. Most offices say we're going to meet over there across the parking lot at the dumpster. Wherever your meet place is, just know where you're going to be meeting and that new employees know where to go. I like this map because it's very simple. This office is pretty simple. It's pretty straightforward. You couldn't get lost in here really if you tried. So their map is very simple. What I find confusing and what I don't think is very favorable is when you have a map that's got 50 arrows showing all 4 or 5 door exits and you don't know which one to follow. Maybe this map needs a "you are here" little button, you are here. So keep it simple is the principle that I want to share with you with how you create your map, and just make it easy to read. Okay? If you have different doors in your practice that go to the staff lounge, doctors, your private office, or a storage room, maybe put a couple little simple signs that look nice and professional that you buy at the store or have made, so there's never any confusion where the exits are. Because what happens when we have an emergency? What's the first thing we stop doing? We stop thinking and we stop breathing. Well, we stop breathing, so we stop thinking. That's, yeah. So we got to, all right, we need to breathe. We need to make it simple so we don't forget, okay? Let's say a few words about the hazard communication standard. I really want to delve into the infection control piece. So I hope that you've got some of the samples that were here tonight, because there's a lot of stuff. And Erica with SciCan brought all kinds of samples, and let's not make her logos bad. She's a petite little thing, right? So the hazard communication standard, we've been following this standard for years. This is a standard that talks about the chemicals that we work with day in and day out, and now we have the right to understand them. That's not only the right to know what chemicals they are, but how do we understand their hazards and how we can work more safely with them. We see that anytime a chemical comes from the manufacturer, it's in its original form and container, it's appropriately labeled, isn't it? You can see the pictograms there on the side. But anytime we put containers and products in a secondary container, then it has to have a certain special label. So when you go back and make sure that you've got labels that have the pictograms on them, that's extremely important, right? Your poster should match this. I know Patterson sells a great product, and you may have already purchased it that has the symbols on there and the labels that go with it. All right, so here's a quick test for you. What's the chemical in the dead middle stand for? Not poison, no. That's the chemical on the lower left. The far left. Acid, thank you. It's burning. Yeah, that's a chemical that's going to be like more acidic in nature. It's going to cause some kind of burning, to the chemical, to our equipment or to our skin or to our hands. What about the chemical symbol that's just to the right of it? It's not a corn dog. You've been sorely misinformed. Well, it's after 5 o'clock, so you might think it's a wine bottle. And this is an ocean class, so heaven forbid you need a drink after this ocean class. Okay. It's a gas cylinder, right? Okay. All right, it's a gas cylinder. How about the very top row, far right? Okay. All right, you're doing good. All right, so that's good. Do you want to review any others, or do you feel good? Bottom left one? Good question. The bottom left one is a chemical that has a target organ effect. That's a silhouette of an individual with a starburst. That simply means that that chemical could target your respiratory system, your circulatory system, your reproductive system. So it's a pretty toxic chemical. The explanation point is a chemical that's only an irritant. You can be around an open little vat of rubbing alcohol that's an irritant because it's very strong and it can burn your eyes. Okay? So that's like an irritant. As soon as you close the lid or you put it away, it doesn't bother you anymore. The chemical on the far left is an oxidizer. That's an O with a flame. We had one doctor that when they looked at our labels, because they were kind of small, he goes, "How come you have 2 symbols that are the same?" And I said, "Get out your loops." I'm just kidding. But the middle one is a fire, is a flammable one. Okay. All right. So this is one example of labels. Your labels may look differently. This is a label that no matter what you have, don't check a little box next to the symbol. Black out the ones that don't apply. Then you can see them easier. I recommend putting packing tape, clear packing tape over any of your labels so that it keeps them from getting wet and ruined. Okay. What kinds of things do you have in secondary labels these days? Pardon? Yeah, you have to write up the information. So what product do you actually have in a secondary container? Sorry? Cabicide sprays, if it's in the original bottle, it's okay, but if it's in a secondary bottle, I see her going, yes, it's a secondary bottle. It has to have the right label on it. You're absolutely right. Perfect. Cold sterile, ultrasonic solution. Most of us have gotten rid of the cold sterile, and that's amazing because I think you really don't need it anymore. Almost all of our clients, like 99.9%, nobody's using cold sterile anymore. It's almost passe. The office that I was in Connecticut, I'll share with you a story. True story. I walked into this office and they had two very dedicated people who were really highly interested in learning. And I said, oh, here's your cold sterile. Tell me what you put in your cold sterile. She goes, well, we put the burrs in here for a holding solution in case I'm not ready to clean them right away. Then we'll take them out and we'll scrub them and put them in the ultrasonic. So very gently, a little bit later that morning, I had to let her know that the cold sterile was not the product to use because when you use glutaraldehyde to soak anything that's going to then be sterilized, I have to go through ultrasonic and then your autoclave, you are fixing the bioburden with that glutaraldehyde. It's an aldehyde. So glutaraldehyde and our cold sterilant solutions or high-level disinfectant is only meant to disinfect or high-level disinfect. And so it's better to have all disposable items that you can get rid of something or autoclavable. That way you don't have any in between and you have a lot less chemicals in your practice. Okay? All right, so let's talk about the safety data sheets versus the old versus the new. How many of you are still paper-based with your safety data sheets? Okay, a couple offices, okay. Okay. Anybody using electronic binders? Anybody using auto SDS? One, only one? I won't pick on you. Anybody up here using auto SDS? Why not? I'm just curious. They're not here, you can tell me. Okay, we'll talk about that too. All right, so the old SDS is on the left, the new one's on the right. You can see section number 2 is where all the hazard information and the pictograms are. That's where you get the information from that section of the sheet. Yes, ma'am? Auto SDS, AUTO. I'll come back to that in a second. That's a good question. Thank you for asking. Yeah. Auto SDS. So if you're managing any of your safety data sheets, whether you're doing so electronically or on paper, they have to be readily accessible and up to date. What's challenging for us, that I can tell you, former practicing hygienist and understanding myself and working with offices as many years as I had, this is an area that we don't have time to put as much effort to with the compliance. So getting everything up to date doesn't mean that manual is set and done. You're obligated to go through that book like on an annual basis and make sure the manufacturers have not issued any updated sheets. And you may have to call them. You have to keep a chemical inventory list. And there are other companies that will tell you a chemical inventory list is nothing more than the products you order from us. And that is 100% wrong. Because in talking to companies, high-level companies that work with OSHA and companies that author writing, meaning they write these SDS sheets on an international basis, those are the kinds of resources that I look to for accurate information. So I mentioned auto SDS because if you're not using this product, I think I would highly look at it if I were you. It's only like $45 a month or something. You may say, one more thing to subscribe to. But what I can tell you is that, doctors, you will get a customized URL for your practice with the products that you buy from Patterson already in this electronic binder. Now, from what I can tell, there's nobody here in the room. Okay. So if you shop someplace else, you can still enter the product yourself. So it's no big deal. You're going to shop at Walmart and buy your alcohol, right? So you're going to just enter the product yourself. And that's what the admin side on the top right is. But for crying out loud, you get this you put a little icon on every desktop, a shortcut. It's like looking at electronic card catalog. And you see that button on the very top far right where it says create report? With the push of a button, you get an Excel spreadsheet with every chemical and every product that you buy that they have in your electronic sheets. That takes you hours and days to do it, and then you have to keep it up over time. So it's just a no-brainer for super compliance. I mean, I'm passionate about it. You've heard me talk about it before. I have no financial interest if you use it or not. I told you some secrets. That's good. So that being said, let's move into the Center for Disease Control guidelines and our infection control and sterilization. I didn't really go out to eat when I got here because the weather was kind of yucky and all that. So in your state, do restaurant establishments have to post their grade from the health department? What would happen if we had to post our grade of how we do for sterilization and disinfection in our practice? A plus. All right, can I put you to the test tonight? Whoever said that. All right, I'm happy for you. Let's keep it that way. So just be thinking rhetorically to yourself, what would your grade be, and can we move that needle a little bit, all right? We know that the Center for Disease Control, our guidelines in dentistry have been published since 2003. There have not been any major changes except for the fact they now use the term standard precautions instead of universal precautions, and they've added a couple of categories like cough etiquette and injection safety over the years. There are at least 4 sections with these 6 that overlap quite a bit with OSHA. The 2 that we're going to focus on tonight are going to be personal protective equipment and cleaning and disinfecting, so we can really talk about sterilization section in your office, okay? Those are the 2 that we're going to talk about, for next hour and a half. We'll probably get done a few minutes early, but that's what our focus is. So let's talk about personal protective equipment. This is the actual OSHA definition of what PPE is all about. So if a sales rep comes to you, I'll jumping up and down and go, you're not compliant unless you buy these level 3 masks. OSHA says you have to have a level 3 mask. Do you see it in the definition anywhere? Okay, just checking. So I say that because sometimes it's how we apply the information. So when you apply this information and go, it has to be appropriate, the third part, it has to last as long as you need it to. A level 1 mask is not meant to be worn during a long crown and bridge procedure, oral surgery, or scaling and root planing. I don't know why this does that. This is not how it did it on my computer at home. So we'll come back to those level 3 masks in just a minute. Regardless of whether you like to wear your logo jackets, your scrub jackets at the office, or use disposable, either way is fine. There are some parameters, though, with those scrub jackets. We know that sometimes, depending on the style of the disposable gown, it can cover your lap a little bit more, right? And that's good. They all make you hot, don't they? I know, this is the South. So please be careful about putting fans in your operatories. Have you ever thought of, anybody have, I'm not going to ask you, if you have those little personal fans for your own thermostat, I understand. And you got a hand fan? She's got her fan tonight. I'm just teasing with you. Thank you. So have you ever thought about how much that little fan is spreading the aerosols in your office, in your operatory, and where all they're going to be landing? You ever thought? Yeah. Have you really? Okay. So now they're thinking about it. So in the middle of your hot flash, you're going to be thinking, Linda says turn off the fan. All right. You all are good sports tonight. Thank you. I think I should keep my day job, though, don't you? Okay. All right. Let's go back on track. Shh. Thank you for playing along. I appreciate you're here tonight. I do. So looking at the right mask for the right task. OSHA doesn't evaluate scrub jackets, disposable gowns, or any of those. They rely on other organizations. Like in this case, it's ASTM, the American Standards for Testing of Materials, that will test these masks. And this is where the different levels come in. Now, you've heard the saying, how's it go? Penny wise and pound foolish, right? So knowing where you can legitimately purchase different products makes a difference, so you know where you can save a few pennies on your budget or be a little bit practical. And when we talk about that, I do want to tell you something. And I am going to be looking into the laws more here in other states. So if you happen to know this, please let me know. In Florida, we have a particular statute about our pharmaceuticals, and perhaps you do as well. And with that statute, it tells all healthcare providers that we have to buy our supplies, our pharmaceutical products, from only licensed wholesalers in the state. And in our state, there's 4 people licensed: Patterson, Shine, Benco, and Darby. Did you hear any other online group here except for Darby? Do you know any other online sales where you can buy things online? Yes, right? Not counting Amazon. So please look into your state laws and find out. Maybe South Carolina Dental Association can answer this question for you. I know they have an in-house attorney just like all the other associations. And find out what happens. Because what happens is, when we shop other places and we're buying something on an online vendor who's nothing but a clearinghouse, I mean, we'll use Amazon as an example. and they're very well respected. We have 4 or 5 of their centers in my town. That they're just a clearinghouse. They're not guaranteeing anything about that product at all. If you're not happy with your purchase with Amazon, they will work with you because they want to have happy customers, right? But they're not guaranteeing that what you're getting matches the lot number, that it truly is, bona fide product, and it's not from the gray market or the black market. So we know of an office in Middle Florida that bought some anesthetic from one of these online companies. And for some reason, the company wanted to return it. The office wanted to return it. So they called in their sales rep, and she's looking at this box of anesthetic going, gee, I'm sorry, but you didn't buy this product from me. I can't take it back. So she looks at the lot number on the outside of the box. Then she takes out some of the boxes on the inside, the individual boxes of the carpules. The lot numbers don't match up. And they bought it online. So this particular office dental assistant thought she was doing good by trying to save money and shopping to a couple different places. She was using 2 of the major vendors and this online source. But she placed her orders online to save money. And then because she wasn't proactive with her merchandise and keeping a good inventory system, she'd run out of something. She'd pick up the phone and call Patterson or whoever, and then they would pay for the extra shipment to come, right? Because when you have an emergency, you have to pay for the extra shipping. And then the stuff would come online, and now she has too much stuff. They have no idea what they had in that practice. And they couldn't manage their safety data sheets because they had products coming from everywhere. So I'm kind of going on a tangent, but please check that out in your state. And I would love to know more if you do find out that law, because I think it's just a curious thing to know. We come back to the right glove for the right task. We have to have the right mask for the right task. You know that I'm a big fan of wearing heavy utility gloves. We have some products out here today for you as well. We got some to give away. I need to figure out how we're going to do this. We don't have, we'll have a system for giving away stuff, okay? It's called Create It As You Go, right? You ever fly by the seat of your pants? No, we don't have any little tickets tonight. So let's give away 2 pairs of Hugh Freedy gloves now. Who has a birthday this week? We have one over here, okay. Anybody on 2? Who else? Birthdays this week? Okay. Okay, you have one too? Oh, this week, I'm sorry, I didn't say it. This week? It was Tuesday, okay. So the 3 of you, okay, raise your hand again. Okay, so the 3 of you can step out at your convenience and visit Rob at the Hugh Freedy booth and tell him that you won a pair of Hugh Freedy gloves, okay? If you can do it now or you can do it later, just sometime tonight, snip out and get, okay? All right, all right. So before we leave this section on PPE, hopefully this is not what your laundry looks like, all right? It's next to their sharps containers. And that behind it is their IT stuff. So this is I need help taking stuff with photos, obviously, with my Samsung 9 is not too good, right? So I need help if you guys can give me any pointers later. We'll have a class after this class because I need help. So look behind it. That's a step ladder and a green-handled mop of Swiffer of some kind. And they have stuff sitting on the steps of the ladder. At least it's not hanging like the other picture I showed you. So we know, doctors, that you're responsible for laundering and providing and maintaining the scrub jackets or disposable gowns and all the PPE. And you're responsible for laundering the scrub jackets as well. So if you're doing in-house laundry, please take a moment and just take a picture of this slide if you like, so you've got some parameters and that you stay current with your laundry. If your temperature on your hot water tank is not 160 degrees, because that's pretty hot, it's real hot, then you can have it lower than that, but use some different detergent to compensate for killing the microbes since this is all contaminated. Because not only do we have the scrub jackets that you all are wearing, but we also have patient blankets, and you may have some kind of towels or lab rags or something in sterilization that you need to wash as well. Okay? Questions on PPE or laundry or anything? All right, you're good? Okay. So let's talk about some legal considerations here with best practices and talk about sterilization with water and just sterilization in general, okay? All right, let's see how you're doing. Since we talked about water last time, perhaps you've tested. If you want to share any success results, I would love to hear them tonight. If you need help troubleshooting, let's ask questions and let's see how I can help you. Crosstex is here. They have some very good products in their water line system. So when we finish this section, if you still have confusion or you want to go out and talk to Donna with Crosstex, please just slip out and go grab her. I think she's like straight out the door, and ask some questions, all right? So when we look at our water lines, we're looking at two different things. We want to know the quality of the water coming into the units, and this is what we call the total dissolved solids. It's all potable water, right? Because the city says it's fine, or your county sanctioned it, whoever your water management company is. But if the TDS is too high, it brings in too much organic and inorganic matter, and it can ruin the equipment over time, especially if you don't have a good system for maintaining your handpieces and keeping them clean and really lubed well. Then they can require more maintenance over time. The second thing that we're concerned about is the little tubes, right? The little gray tubes where the water transfers through, and we use the air water syringe or the high-speed handpiece or the ultrasonic handpiece, and the water's going into the patient's mouth. That's where we're concerned about the biofilm. I mean, biofilm grows on anything, right? It grows on rocks in a creek. It goes everywhere. It goes on our mouth. It's all over. So it's hard to get rid of that and maintain it. And many times over, we find that because we didn't really have a clear understanding, and I was included in this, right, until the past couple of years when I've been trying to educate myself more on delineated water lines. We all thought that we put a couple tablets or a tablet in your water bottle, and that's all you had to do. We weren't shocking the line. So we're going to be talking about those things in just a moment. So we know that the federal law, the Environmental Protection Agency, and the CDC, which is law in your state, says that you have to have less than 500 colony-forming units in those water lines. The American Dental Association has told us in their best practices that because the products are so effective and so good, you should try to keep it down below 200. And did you know that actually the research substantiates the fact that when your CFUs get to 200 level, that they're going to grow so back so fast that you'll be over the 500 in no time at all, especially if you're not doing regular right shocks. So that's Microbacterium abscessus on the first little picture up there. But what's growing in your agar plates? Do we know? Let's find out more, okay? So we talked about the lawsuits earlier that happened in the pediatric offices, right? One was in Georgia, which the CDC has written a nice summary paper on. That's about 5 pages long, going into some background with it. And then I don't know about the lawsuits there because they're not seem to be, I just haven't seen that in the news, and I don't know anybody that's working with them like I do with the lawsuits in California. So this was one of the children, though, Mimi, that had some pretty bad outcome because of her infection. All the children that were impacted in Georgia and California were impacted because they had invasive procedures. They had pulpotomies, they had extractions, and we typically don't use sterile water on those patients, do we? Well, guess what? In California, you now do because they've changed the law. So things are changing rapidly. So what they contracted was Microbacterium abscessus, and this bug, oops, it's not there. Okay. This bug is in the environment. It's natural in dirt and everything. It's not something that should be in our bloodstream. The children that had to take the antibiotics for this were the same antibiotics that are used to treat leprosy and TB. Yeah, pretty strong stuff. So when we think about controlling your dental unit water lines, there's 3 main ways. Now, I'm not going to talk about office-wide systems, but if you have a question on that, come up and talk to me later, because that's a whole different system. If you have a big system on the wall and you've got a purification system for your whole office, there's different ways of treating that. And that's less offices have that system than they do water bottles or using tap water, for example. So we can use straws or drops. Hugh Freedy has a dropped product. Crosstex has straws, and they have an inline cartridge, and I think they've got a shock tab, but I don't think they've got tablets. So we have 2 companies here tonight that have delineated water line solutions, all right? So the tablets are good, but you have to remember to put the tablets in, don't you? You have to stay consistent. You want to be really follow through on all that and be really thorough. So it takes a team that's engaged. And the minute you have a change in your team, somebody's out sick, you bring in a temporary staff person, you hire a new person, they have to get trained on this system. The straws are nice because once they go in the water bottle, then they last about a year. And you don't have to do much to them. They're there. You just fill up the water bottle. You do have to be careful that they're installed properly and they're not contaminated when they're installed, or you will get bad test results. And then third is an inline cartridge. let's suppose your practice, you don't have the independent water bottles, you don't really have room to add them, or it's not feasible. In the junction box for the chair, you can add in a cartridge. And that cartridge then filters the water before it goes through. And that's where it gets shocked as well. Okay? So those are like 3 main easy ways of controlling the water line. So one thing I'd like you to add on your radar to look at, and this is very important. I'm going to be talking about OSAP quite a bit tonight because this is really a wealth of information, and there's just a lot of folks that aren't aware that OSAP has actually been around. OSAP stands for the Organization for Safety, Asepsis, and Prevention. They've been around since the 80s, and they are global industry leaders for infection prevention in dentistry worldwide. They are the global leaders. So, but they're right here, headquartered in Atlanta. So they're like right here on our side of the country, southeast. And it's an organization that you should definitely go to their website and check out their resources. Dr. Shannon Mills and his colleagues published a white paper about dental unit water lines. It's probably about 12 pages, but you can filter through it and pick out the sections that seem like you want to start on and apply to your practice. And look at what they recommend. They recommend that you conduct the bacteria testing on your water lines 2 consecutive months until you get passing results. Or get 2 consecutive months of passing results, I beg your pardon. Get 2 consecutive months of passing results and then go to quarterly testing. This is a best practice. So far that I know of, California is the only state that has implemented law. For example, if you know you have never shocked your lines or you've got failing water tests, then you go, okay, we need to shock the lines. Let's get a system going, shock them, and then test. Wait 2 to 4 weeks after you shock, so that way you're not getting it like the day after. You want to get a more accurate, average reading. I mean, then you need to determine with the product that you're using, what's the instructions for use. Did I teach you the little phrase last year, IFU? No. IFU, instructions for use, all right? That's mandatory. Having your instructions for use for all your equipment and your operatories and in your office, your sterilization everywhere is really important to have. Even your pop-up wipes have IFUs, okay? That's how detailed it really is in our world. So I recommend that you do use a third-party lab testing and then do some in-office testing if you're going to do more frequent testing like quarterly. The reason that I recommend a third-party testing group, and here's a couple of companies for you on the lower left, is that now you have a third party who's evaluated it. Earlier this evening, I talked about using a third party to do forensics if you've ever get a breach, not letting your IT company do it, just the same thing here. If you have third-party validation, it's the same kind of philosophy. Agenix.net sells their tests for about a package of 4, and then you can add more according to that. You will pay more for these only because you have to pay for the shipping. But otherwise, the individual test run about the same as the paddle that you can buy from Patterson. And I don't have a picture of the paddle test in here tonight, but I recommend not doing the paddle test except for doing it intermittently, because has anybody done the paddle test? Do you know what I'm talking about? You've done the paddle test? Okay. Anybody else done the paddle test besides them? Anybody over here? No? Anybody over here? Paddle test? No? Okay. Oh, you did? Okay, good. So let me just kind of go over it for everybody else real quick, okay? A paddle test is where you buy a little container from Patterson, you fill it with the water, and when the paddle itself goes back into the little plastic container, it's impregnated to grow the bacteria. And you kind of look at how many little dots you have, and you kind of compare it, just like you would if you were testing your pool, and you want to look at the litmus paper. You look at this against the color coding, and you see, then you get a range. And tell me what's the range say? Who was it that raised their hand? Paddle test? Who did the paddle test? What kind? Do you remember the ranges on it? No? Is it like high and low, pass or fail? Categories, right? It has ranges. So you won't get an exact number, but you'll get like a range based on how many of the little dots turn, black, or if they went gray. Now, correct me if I'm wrong, but they fade out over time, right? So I recommend that if you do these paddle tests, take a picture of them. So now you have a legal, documentation you can keep electronically, and then maybe in your records, in your check sheets, you can, your log rather, you can write that down. So if you get a paddle test, it's more subjective to read it. They can be done, but once a year, I recommend that you at least do the third-party testing so you get a number But if you have never shocked your lines, or it's been a long time, I would shock your lines maybe even twice, 2 weeks in a row, and then do the outside testing, and then see where you are, and then begin to develop your plan of action, okay? Does that make sense? Okay. Question? Yes, ma'am. Okay, good question. If you're using distilled water in the bottles, if you have distilled waters, you still need to put the tablets in the bottle, yes. Because most companies have a maintenance product that goes in the bottle, even if it's distilled, and then the shock tablet, which is separate. Yeah. So you still have to use it. Yeah. Good question. Yeah. But we have one client in Florida that thought that they would start taking the water out of their water cooler because it was a nice dispenser and they had to keep a lot of extra jugs. But guess what? Just like your Keurig, there was biofilm in there. So they were bringing in contaminated water to put in their water lines and doing bacteria testing and failing. And they couldn't understand why. So be careful, because sometimes our workarounds can get us into trouble. Other thoughts or questions about water lines? So you have your homework assignment on that, right? You're going to download the OSAP white paper, do some shocking if you've never done shocking, and then let's talk about shocking, because sometimes you'll read a product that says to use bleach. Is anybody shocking your dental unit water line with bleach? Okay, let's talk about that for just a minute. All right, because I don't think I put in anything tonight about the amalgam separator law. But under the federal amalgam separator law, you're not allowed to use any chlorine or iodine in the suction lines. Now we're talking about the suction lines, not the water lines, okay? So in the suction line, when you're cleaning your suction, even if you had a bloody SRP or a big surgical case, you are not allowed to use bleach in your suction lines, because chlorine and iodine interacts with the amalgam that's gone through there as well, and it helps to release more mercury back into the environment. So if you choose to shock your dental unit water lines with bleach, a diluted bleach product, that has to go down the regular sink. You cannot suck it out with your high vacuator, okay? Because then that becomes illegal. Does that make sense? Okay. All right. So let's switch gears now. Ready? All right. Let's talk about how you're cleaning and disinfecting your operatories. Who prefers spray in your technique? Anybody prefer spray? I see a hand go up back up there. Anybody else prefer spray? We have more than one person, I'm sure. No? All right. Well, okay, sprays. Anybody use wipes? Okay, more hands. All right. Sometimes you use a preference with both, right? When you're using spray, most of the times, and correct me if I'm wrong, you like it because it gets into the crevices and the little cracks and the grooves on the buttons and everything. You can typically put a barrier over your air water syringe, and that solves that problem right there. Now, what happens with aerosols, though, is in the environment. So be sure that you're wearing a mask when you're spraying and disinfecting your operatories. And then it has to stay wet according to the manufacturer's instructions. And then when you bring your next patient back, if you still smell the little aroma or fragrance, that means you're inhaling a chemical as well. So look at the safety data sheet and see what chemicals are in the sprays that you're inhaling. And you might choose then to switch over to the wipes altogether and use some barriers on the areas that you're worried about with the spray. All right. Sometimes we use both, but we cannot use them at the same time. You do not spray and then get a pop-up wipe and wipe, because that is not done. That's not completing the clean and the disinfect step. You're only doing the clean step if you're doing that. So let's look at that closer. If you're using a spray technique, the first spray is the clean spray. That gets wiped off right away. You may have heard me say I use the word marinate. Don't let your room marinate while you go to clean your instruments and come back and start spraying again. You have to wipe off that first spray right away to actually clean those surfaces. Wipe it with the paper towel, because that's the cheapest, most economical thing to do. You can spray the paper towel, make it a little more pliable if you like. It's the second spray that has to stay wet according to the manufacturer's instructions. So that's why knowing the IFU is important. Is it a 2-minute TB kill time, a 3-minute, 1 minute? Optum 1, I think, is a 1-minute TB kill time out there. So with the wipe technique, it's wipe. And you're going to use multiple wipes, right? Because one wipe isn't going to get to the whole area, right? Who do we need to talk to in your team? Just call me. I'll have them call me. I'll tell you. So one wipe doesn't work. And likewise, I watched a veteran hygienist in a room one time. She had her pop-up wipes, and she got a whole handful of wipes like they were a little wad of toilet paper or tissues or something, for crying out loud, right? And she used that one ball of wipes for everything. And that was it, one wipe, and she was done. So we'd have a training session after that, obviously. But it's wipe, throw those wipes away, and then get new wipes to clean. Please keep the lid closed, because now you're wasting your product, because the first wipe is going to be dry, and then the solution in the bottom that you can at least shake it up and keep them wet is going to evaporate. Okay? Am I preaching to the choir? But you knew that, right? But still not. Nobody has any wipes like these, right? This is a true office. All right. For some reason, they didn't invite me back. I don't know why. Unfortunately, using 4x4 gauze is not an acceptable practice, because now you have the chemicals in the gauze interacting with the chemicals in the disinfectant, and it may be rendering the solution less effective, okay? So it's cheaper just to make your, use a spray or use pop-up wipes. Let's talk about the different products and why you're choosing certain products and what you're doing with them. We have several companies here tonight, at least 3, that have pop-up wipes. You may see, you get a sample of the ones from Optum, the SAGCAN one. Those are not alcohol-based. They're hydrogen peroxide-based. So they are super safe when it comes to not having any hazards and not being a hazardous product. If you try any of the wipes tonight and they're different than what you use in your office, please be sure that you use a light soap and water rinse before you use the new product. Because that Optum 1 is going to lift cavicide right up, and it's going to make something look white or opaque, and you're going to say, oh, look what Optum 1 did to my countertop. But you've got residue from cavicide or any other product that is actually going to be lifting up. Okay, so please be sure, and that's regardless of whether you're using Optum 1 or whether you're trying the Hugh Freedy product with the Advanta Clear, which if you're trying any new products ever, make sure you do a light soap water rinse over all those areas, okay? We're working with an office, the office I was with just in Connecticut is using the house brand of a wipe from another company, not Patterson's. And when we looked at it, it had like 45% alcohol. And one of the hygienists was quick to point out to me, you know how when you press, your buttons for your x-rays are outside the room, right? You step outside the room, press the x-ray button. Most of the time you put a barrier over that, right? They weren't using barriers, because she said the barriers that we have won't stick to our, and it was a really big button, so it was very old fashioned, won't stick to them. So we've just been wiping them down, and they looked horrible. They were quite ruined. So when we looked at the product they were using, I said, you've got 45% alcohol in here. So it's going to make anything ruin over time. So please evaluate the products, not just on price, but what's going to help uphold, doctors, your investment in all that expensive equipment and your chairs. Okay. All right, let's get into the meats and potatoes here. Infection control with sterilization, all right? Pre-cleaning. Well, you got plastic silverware tonight, right? So we really couldn't evaluate it, I guess, for cleanliness. But next time you eat out, look at your forks. You probably already do that, don't you? And if you're really germ-phobic, you don't let your silverware touch the table either, do you? Okay, that's good. I'm just checking. This was taken in an office earlier this fall. What do you see wrong with this picture? Too many instruments in there. Can you see that cassette poking right up? Okay, here's a real technical definition of what that is. That is called, are you listening? That's called a drive-by. So what happened was, I went into the sterilization before they turned it on the first time and put in my Hugh Freedy monitoring thing, which I'll show you again. And then the lid was closed, and we made sure it was on the right time that they wanted. So about 10 minutes, 15 minutes later, I'm going back in there to check for my device, and it's still running. It was like running more than 15 minutes. So this is curious. It's still running. We should be off by now. So I turn it off, and I raise the lid, and I look at it. So what happened was somebody did a drive-by. They had a student working that morning, and I don't know if it was her or somebody else. They had a student intern working. And they just, to me, that's when the unit is running. You have instruments that need to go in. You say, oh, I'll just toss them in with the rest of them. You toss them in, and you crank that time back up, don't you? Right. Okay. You're not following the instructions for use. Okay. So what happens is now it may be overloaded because now she's filling it up so far she can't even get the things covered. And when it's overloaded, the unit is not working properly and it's not cleaning. You may think, oh, the instruments on the bottom are getting real clean, and that may not be the case. We're working with a really nice office and down on the coast, and before they transitioned and remodeled their, they have 2 sterilization sections, one for hygiene and one on the doctor's side. And they'd already remodeled the doctor's side. So before they remodeled the hygiene side this summer, I went in and looked at their ultrasonic one day, and they had all these hygiene cassettes lined up, standing on there. The top 1 inch of them weren't even covered, and they were all set next to each other. So I put my little strip in there, and nothing was getting clean because there wasn't enough room for the cavitation and the activation to work in the solution to actually soak around everything. So how you use your ultrasonic is critical, because if it's not clean, it's not going to get sterile. However you test the unit is totally up to you all. You may choose to use the tinfoil test, and that works really well. It's a subjective test, just like when you're reading the paddle test, you have to learn how to do this. So if you don't want to use that and you want to use the Hugh Freedy washer kit, talk to Rob outside and get some information. I think it just takes the guesswork out. It's easy, it's quick, you know the machine is working properly. When the instruments come out, they need to be dried and then wrapped and sealed properly, okay? I know not everybody wraps a Christmas present real well or a birthday present, but if you need to learn how to wrap a cassette if you have cassettes, or use bags, okay? Let's talk about some sterilization faux pas for a moment. These are a series of some pictures that I want to share with you just to kind of see where you're at and where you may need to, kind of think about elevating your practices. These are kind of small, so I hope you can see them okay in the back. But that's a picture of some sterile instruments that actually came out of the sterilizer. This is all set up for us. Even though they're sitting next to an open ultrasonic, they did not come out of the ultrasonic. But when you look at that tray, you see nothing wrapped, do you? And you see then there, you can see that there's some oral surgery instruments in there. So then they take out these instruments out of that were sterilized, all open, not bagged individually or as a group. In some cases, you could put a few items together in a bag, right? And then they set them up on the tray and cover the tray and then proceed to wrap it and store it. That is not the standard of care. So please don't fool yourself and think that you can do something like that and have all the cassettes ready. I know oral surgery instruments are a little different, and sometimes they are sterilized in towels and not bags or cassettes. But regardless, storing instruments like this is not proper. Anything that comes out of an autoclave or any sterilizer that's not bagged is meant for immediate use. So that means that you drop the handpiece or something happened, it's not working, and you need it like right then. So here's some more sterilization faux pas. Another one comes in with how we load this device. This is a weak area in our practices because oftentimes it is overloaded and it's not working properly and we don't even realize it. So the top one is not correct because we can see, they've got too many cassettes laying on top of each other. When you buy an autoclave, there are different trays you can buy with them. You can get different type of tray to hold cassettes. You can get these different trays to hold the bags, but they aren't meant to be commingled. What you see wrong on the bottom shelf there, obviously too many items, and we need to know what is the instruction for use for this unit. Is it supposed to be paper down or plastic down? And then here's some more correct ways. And that's the instrument loader tray that I was referring to with how cassettes would be loaded into an autoclave. Okay. All right. So how many of you have problems with instruments being wet by chance? Anybody have problems? Okay. So let's talk about that. Let's be real about that for a minute, okay? This is another weak area in your practice. In my experience, this may not be your experience, so please know I'm not making a judgment call here, but in my experience, we have wet instruments because a couple things are happening. One, they did not go in the autoclave as dry as they could have done. And I don't mean drying off the tips of all the little pointed sharp ends. I'm just talking about like the handles and the cassettes and things. And two, if you have an autoclave where that door pops open so it dries, the minute that door pops open, many times over, we mistakenly think it's okay to take those instruments out and let them air dry. And the minute we do that, we're violating the standard of care. We're violating the instructions for use because that paper that's all wet is like wicking material and it sucks in all the bacteria and all the contaminants in the air. This commonly happens if you're doing it. It commonly happens, and doctors, you may not even know that this is maybe happening because we're seeing it in the back end. Is that because you're rushed and you need to get the instruments out sooner? So that part makes total sense. But that might happen because one, you don't have enough autoclaves, or two, you don't have enough instruments setups. And I know for sure, when talking to different instrument management companies, is that the minute you install an instrument washer, automatic washer, then that's gonna come out with, you've got all these cassettes and instruments that are in there that are ready to go to a sterilizer. And if you only have one autoclave, then you're not prepared. So there's a whole system, and I'm not the most savvy person, but I've picked this up from talking to folks like Hugh Freedy and others, and just from my observation working with practices. I'm fast becoming a fan of this. This is the new Sycan sterilizer called this StatClave, I think. So if you haven't picked up a piece of information on that, pick that up tonight. What's nice about this, it has the same size chamber as other autoclaves, and it comes with all the different trays that we talked about for holding cassettes, holding pouches. It's a good short time on turnaround time. And because with Sycan products, you can tap into their G4 system and electronically monitor the device. So now you can get your load number out of there if you need to, if something fails. And you can get, you get all that information electronically. So it's a really cool device. Like I said, it's up to you to take a look at it, but I just want to share with you about how technology is changing things. You know that in your state, you are mandated to not only sterilize high-speed handpieces, surgical handpieces, low speeds, contra angles, profi angles if you have any old metal ones, cone sleeves, and motors. So please check on that. Make sure that you're moving towards that standard of care. Doctors, I recognize when we start talking about this kind of equipment, I understand this is capital investment. We're coming to the end of the year. Maybe it's time for some write-offs so you can talk to Elizabeth Affinity Bank if you need some cash, or talk to your Patterson rep about how to manage this best in your practice, okay? When it comes to sterilization monitoring, the Center for Disease Control tells us this needs to be done weekly. So please keep good records on this, all right? This is extremely important, extremely important. One thing that we're not doing well is that we're not keeping our records disorganized. And so I didn't remember to bring it in because of the rain, but we're going to give out I'm going to give away one of our quality binders tonight to you. And it's a place we can keep everything in one location because we're really passionate about how you have it organized. So when you run a test, when you have a failed test, sometimes it can happen because the test is bad. You know when you look at your little skinny test strip and you know how it's sealed at one end, right? Okay. So when you go back, check on this Monday, but take your test strip out, take your thumb and kind of gently flip that little end of it so you can kind of see where it's sealed. If that's not sealed properly, you could have a bad test strip, which could cause you to have a failed test result. There can be any number of things that can cause a failed test result, but that is one. So whether you're using in-office testing or third party, it's entirely up to you. But when you get a failed test back, take care of it right away. Don't assume that it's nothing to worry about. Because if a patient ever said that they contracted disease in your practice, you would be the ones that would have to furnish that information. Say, here's our test results, we passed. Okay, that's why I recommend when you put quality and safety and compliance on your team meeting agenda, bring your quality notebook there and take a look at it. Say, okay, how are we doing on our test strips? How are we doing on our water lines? Just like a 2-minute review. And then you can kind of keep your heartbeat, all together and everything working well for compliance. Here's a couple other times when you need to test these devices. Whenever you have any new packaging material, if you switch from using bags and now using cassettes and wraps, you do an extra test. If you're training new team members, we worked with a client over in Athens, Georgia a couple of years ago. They have 3 autoclaves going all the time, 3 doctors, busy practice, 3 or 4 hygienists. And they were getting a failed test in one of the units in particular, and they decided that they had too many team members running the test, and they would back it down to just 2 people so they could get more calibrated and make sure they were actually doing it the same and that somebody wasn't doing something slightly differently. After a sterilizer has been repaired, this is a critical time because we know Patterson is going to have your back. They're going to do their own tests, right? They're going to send you back a piece of equipment that's working. But what legal documentation do you have that the test ran and that it was perfect? And then after you're changing anything with your loading procedures, okay? That's really important. So let's talk for a couple of minutes about, let's talk about any questions there. There's a whole host of things that I know we didn't get into as far as the sterilization process, but if you had anything on your mind tonight that we didn't talk about, we've got time and we're still going to finish early. But what other thoughts do you have? What other concerns? Well, all right. At least you're awake. All right, nobody's nodding down because we're going to turn off the lights. We won't wake you up.
Mine is, I have a question.
Yes, ma'am.
We still use cold sterile in our office.
Cold sterile, okay.
And this has been I guess, a battle between get rid of it or not get rid of it. We use the pre-made matrix.
Pre-made baker's man, okay.
Yeah. So with us using that, I believe in putting it, running through the ultrasonic, the time it should, put in a cold sterile before we sterilize it, steam sterilize it.
Okay.
Do you suggest that? Only because I think there's like lead bead on some of them. Or
Okay. So the question about using this particular matrix brand they're using in their practice is that they're putting it in ultrasonic, then cold sterile, and then steam sterilizing it. I don't know that you necessarily have to do that because now you're putting another chemical into the autoclave for it to be steam sterile. So I would make sure that it's going in. If you're concerned, here's a thought. Anytime you have a concern about instruments not coming out of your ultrasonic as clean as you want them to be, not only do you need to look at the instructions for use and make sure it's being used properly, but sometimes you may need to look at some pre-treatment on something like burrs or matrix bands. Are you familiar with the enzymatic sprays that you can spray on instruments, a cassette? So maybe you need like a spray, and you can spray them down like in the room before you're leaving, or spray them down in the sink while you're doing something else and let them sit there for a minute or two to begin to break down the bioburden. Hugh Freedy's got one. Dentsply has one. I don't know if that young lady made it here. She's new. What's her name? Valerie Kaiser? Valerie Kaiser with Dentsply is here tonight. So they have one. So there's a couple of companies that make enzymatic sprays. I would use an enzyme spray first and not put in cold sterile. Yeah, because then you're getting another chemical on it. Yeah. Yep, then you're good to go. Yeah. Other thoughts or questions? All right, no? Labels on the pouches. Let's talk about that. Thank you for asking that question. Is that you? Who asked? Okay. So labels on the pouches. We didn't talk about this as a very important step as well. Your pouches should be date stamped. You should indicate which device, if you have more than one sterilizer, which device it was in, and then keep a record of what load of the day it was, and the individual's initials that wrapped it. What I'm finding is a challenge. This is information that's from the Center for Disease Control. So did you all hear? Okay, so we're probably not doing any of that, are we? Here's the thought process behind that. If you have a failed sterilizer run, you need to be able to see if you can recall those instruments somehow. So we need to be able to identify, because in a crazy busy practice, more than likely you have a statum and at least an autoclave, right? And you may have multiple autoclaves. I have several clients that have multiple. So we need to know what sterilizer was used in, or what sterilizer it was sterilized in. That can be challenging because when you have multiple people coming through sterilization, you don't know actually which instrument. So then work that out the best you can as a team. I have some offices that say this is the doctor sterilizes the hygiene, but that may not work for your practice, so you may not know. And then also bear in mind that you're going to be using the same instruments more than once a day, right? So I understand where you think, what's the practicality in this? But just start moving in this direction, because we have to show a good faith effort that you at least know the date on there if you don't know the sterilizer. Because those bags are only meant to be stored for a certain length of time according to the instructions for use. Most bag manufacturer pouches and bags say that it's for maybe like a year or 3 years, unless something happens like they become torn or ripped. So understanding what that manufacturer says, how long that bag is good for, you may not want those instruments to be sterile and sitting there for longer than a year. Now I know from the hygiene experience, your instruments aren't going to go cold for a year. They're going to be cold for an hour before you use them, right? Because they're going to be over and over. But sometimes, doctors, there are procedures that you may not do as frequently, like maybe it's an extraction or something with implants you're not using as frequently, or there again, endo. So please know that that's the standard of care that you will start seeing, and you're hearing more consultants and more salespeople tell you about that. But how we make it work in dentistry is not as easy. Here's the parallel to what happens in medicine. If you go to a surgery center and you have a procedure or surgery done in that particular OR, there are records of where that instrument is set. And do you know they call it a casket, actually? A casket is, in medicine, they know what OR that was used in. When it gets autoclaved, they know who the people were in that OR and who processed that cassette. We can't quite show that level, but we are heading more and more in that direction because many more dental practices are becoming accredited by outside agencies like the Joint Commission or another one called the AAHC because they want to have that quality mark. And that's where I just came back from big infection control summit with Hugh Freedy, and there was nothing in the room, nobody in the room except DSOs from different size companies. And they have quality measures in place that we don't have in our private practices. So that standard is rapidly shifting. And just make sure that you're following, to the best of your ability, the CDC guidelines for infection control. So I highly recommend that if you don't have a full copy of those guidelines, to download those full documents. It's a little over 100 pages, and add that to your books, because that's the standard of care that you would be judged by if there was a patient complaint or any issue happens with sterilization. So thank you for your questions. Those are all good. So I'd like to shift gears for just a minute and talk about this whole lockout, tagout thing. So I apologize, this is not in your handout, so please take pictures here if you don't mind. And if your phone is not working well, your battery's dying, then maybe somebody in your team can share that. This is a really important one because OSHA says that doctors as employers, you have to have a safe workplace, right? And you have to control hazardous energy sources. Hazardous energy can come from radiation, it can come from sterilizers, and it can come from other sources. And we have to have a process for when something goes bad or breaks, how do you either lock it out, meaning you fix it so that nobody can use it mistakenly, or that you put a tag on it. And I thought, this is the honest truth now. Until this week, I never thought this particular regulation was very applicable to dentistry. And I'm going to, on the heel of that, I'm going to ask you, does anybody read Dr. Bicuspid newsletter? Anybody at all read Dr. Bicuspid? Okay, nobody? You guys are missing out. Let me just tell you, it's free. That and go to OSAP, all right? And those are 2 takeaways tonight. Let us talk about OSAP and how you need to read Dr. Bicuspid because this is what came out this week. Take a moment, just take a look at this, please. Dr. Bicuspid actually ran this story twice. This is only part of the top of the story. The first story didn't mention that she was pregnant. So what happened was this particular sterilizer was taken out of use because it was not working. It happened to be a Tuttenauer. And it was put into like a storage closet. And it's from the way I read the article, it sounded like maybe one of the doctors in this oral surgery office was kind of fiddling with it to see if it was working. And I don't know how they could get it running someplace without a water source and a closet, but it was somehow running or doing something. She went into that room to throw away some biomedical waste, and that's when it must have exploded. So what didn't say in the article is that by federal law, doctors, if you have any deaths in your office, that's reportable to OSHA within 8 hours. I'm talking about employees, not patients, okay? Patients, you call your attorney. At first, you call 911. No, seriously, let's back on track, sorry. Because we value patient lives. We do everything we can to be safe. It's safe for everybody. If you have any amputations, loss of eye, or hospitalizations, those are reportable to OSHA within 24 hours. And don't you think she had a hospitalization? No. So I never would have thought this would apply because how often, I mean, actually, I have made a crazy joke, which now it's a sick joke, about what happens if the sterilizer blows up. So I will not joke about that anymore because now that it's happened. I've never heard of this before. I think we're hearing more of stories because social media and program. I mean, Dr. Bicuspid comes out practically every day. It will flood your inbox. But you could read the weekly and weekend review or something. You get all caught up. So here's some more. So just look at this, okay? Doctors, this is what must you do to protect your team. Develop and implement and enforce an energy control program. use lockout devices for equipment that can be locked out, or tag out devices for equipment that can't, in lieu of locking it out if you can't lock it. Ensure that the new or overhauled equipment is capable of being locked out. And then lastly, develop, implement, and enforce an effective tag out program if machines or equipment are not capable of being locked out. Locked out just means you can't use it. So obviously on this particular case, they didn't take the door off, they didn't take the cord off, they didn't take the gasket off, so it was they didn't render it unusable. So somehow somebody was able to plug it in, turn it on, and make it run temporarily. So please put that as a note to do to self of what, when it comes to information here, updating your manual for the hazard energy policy. I don't have information in here right tonight, but there is information on the OSHA website that we're working on getting. Okay. This is something that we've not ever talked about before. Does that make sense? Okay. When I came across this quote really spoke to me, because we know everything that we do matters. Because day in and day out, when you're simply updating a patient's health history or performing a simple prophy or updating some x-rays, you may feel like, what's the big deal? But day in and day out, patients are trusting you with their lives in your hands. So a lot of things we talked about tonight, I think you're already on the good route because you're here and you care already. There are things probably just a tweak. And the symbol of the piggy bank or the dollars, it just reminds us of sometimes there are places where we can change our budget and conserve a little bit, and sometimes we don't want to be penny wise to be pound foolish. Like I told you the story of the office in Florida where they were buying from a non-licensed, third-party company. They were buying their products illegally. So here's next thing I'm going to show you is a class action lawsuit again. Let's talk about this one again, okay? We looked at this early on tonight, and we said, okay, this particular practice was being charged with hiring inexperienced, untrained, and unlicensed students, dental assistants, and other employees. So tonight, one thing we should be thinking about is, what is your onboarding process for new team members, or for temporary team members, or for a dental assisting extern? We're usually, when we're shorthanded and that new team member starts, it's like, oh, great, you got 5 years of experience. You feel like, okay, she didn't need any help. She knows exactly what to do, right? And we can't make that assumption. Not that everybody coming to you hasn't had some valuable experience and that's why you're hiring them, but do they know your practice? We were contacted by somebody late last week who needed her certificate from Georgia, where we did a program early this year, so that she wouldn't have to sit through OSHA training again. And I don't know what the whole story was because I didn't help her, but perhaps she was thinking, I need this certificate from y'all so I don't have to go take OSHA training with my new office or something, which is totally incorrect. Having OSHA training once a year does not suffice for every office that you work in or if you change jobs. Because the federal government is going to want to come in and see what's in your practice or what's in your practice or what's in your practice, not what somebody's taking from office to office to office. So what I encourage you to do now is think about how you onboard new team members. Do they sit down? Do they have a chance to read your policies and procedures? Do you have an infection control set of policies and procedures? What top couple of things would you show an intern who's coming to do the dental assisting time with you, or a temporary team member? Temporary agencies are great to work with. I have friends that have companies and they're very successful. It's a great way to help when you're shorthanded and there's not much time to train them, obviously, but what can you let them do for 10 or 15, 20 minutes, whatever it is, so they know how to run the equipment? Or maybe they don't touch the equipment and they only do X, and then your team members do the rest of it. What's your system? This now, doctors, tells me that there's a precedent in the legal world. I don't know where this case is going. It's dated, May. So 6 months later, I have no idea where the case is right now. But this is absolutely a precedent. Let's assume this goes forward and this office is judged guilty or the doctors are held guilty. Now we have a case in Virginia that attorneys can look at, plaintiff's attorney, and go, there's already been a case set on this. Doesn't necessarily have to be case law in your state. They can look at other communities elsewhere. And when you look at the standard of care and you think about that definition of it being, what would a similar practitioner do under the same or similar circumstances in your community? Our community is worldwide. It really is a global community when we think about disease transmission, but our community would be within the scope of our laws from the United States, right? So that kind of begs the question. I'm looking at things and I'm kind of extrapolating on the aggrandized side, perhaps. but just thinking about making sure that we're aware of these situations so we don't fall into that gray zone. So when you download the CDC guidelines, there is the summary of the CDC guidelines. And I pulled this from the summary because they're prettier, they have colors, they're shorter, but they don't have all the full information. So when you download the CDC guidelines for your practice, I would highly recommend that you get the full version so you have more detail. But look at this. This says 5 quick things: develop and maintain infection prevention and occupational health programs. All right, that's your policies and procedures, some of which are infection control related, some of which are OSHA related. Provide supplies necessary for adherence to standard precautions. We didn't talk about hand hygiene tonight, but we did talk about other PPE, and of course the safer needles that you should use. Assign at least one individual to be trained in infection control, infection prevention, and coordinating this program. Just in the past year, OSAP has worked with Dale Danby, you're familiar with the Dental Assisting National Board, to create a credential for infection control in dentistry. So when you look at these recommendations, our standard is moving towards that direction. Because when consultants like me get it, and you bring in somebody to do training for you, you want to know, is this person certified? What credentials do they have to do that? Plug in that PowerPoint programs and train your team, right? They will have multiple certifications, so they'll have certifications for team members. We may fall into that as consultants. Then they'll have one for industry folks, our partners outside. So who's coming in and giving you that CE? What are they teaching you? Because we know everyone here, Dentsply does a power hour, SciCan probably does. They offer you great services and information, and they're focused on their products. And that's okay, but at least you're starting to learn. That's one way that we do learn from manufacturers' reps. And now in the next couple of years, you're going to see this status change. So how do you continue, team members, if I can talk to you all for a minute, how do you continue to bring value to your team? Would you get certified in infection control? How would you raise that bar? So take a look at what's being said on your on-hold messages and what you say on your website about your team training and the standards in your practice. Because we want to have power behind that, okay? So what did you think here? Did you raise the bar a little bit? What did you, I've got a couple more slides. So when you walk away tonight, what was something that you took? Would anybody be willing to share something? I'll dry the instruments before they get back. Sterilize. Thank you. Yes. Thank you for that. That's a good one. Yeah. And what else? Anybody else take away a tip? You took a lot of pictures, sir. Paper down. You need to read your instructions for use. Yes. Load them right in the autoclave, right? Anybody else have any tips? You all took some practices, some pictures, so hopefully you're going to go through those, right? All right, good. So one of the things that we saw in the CDC guidelines was having policies and procedures and a whole program. Who's using cassettes? Okay. If you're using cassettes, you're automatically a candidate for the Green Light Compliance Program because it is free. If you're not using this program and you're on cassettes, I would highly recommend that you stop out there and talk to Rob about this, or call him later if you want, because he's going to be swamped maybe, but please do. Green Light Compliance is a program that Hugh Free offers to cassette users, and then you're probably buying some of their other products along the way, that you have a whole series of infection control policies and procedures from soup to nuts. You'll have a job description for the infection control coordinator. You'll have information that's state-based, so what's required here in your state that may be different than Florida, New York, or California. And you'll have every single policy and procedure that you need, how to take care of your dental unit water lines, how to manage hazardous waste, scrap amalgam, how to clean, disinfect an operatory, down to how long you're going to store sterilized instruments. Everything is in that program. So I would highly recommend that you take a look at this program because it is entirely free. If you're thinking of moving to cassettes and want an evaluation, then you could talk to Rob about that. He could come out and give you some evaluation. We talked about joining OSAP. I don't have a whiteboard here, and I didn't put it in my slides, so I'm going to give you a code if you don't mind, okay? I was talking to the executive director today of OSAP, and I said, I wish I talked to you earlier in the week. I forgot to get a code. I want to give, can we help people, join OSAP? So if you're not a member, here's a 50% off coupon for you. And I do not get the other 50%, okay? It's 50% off. We don't have any fee splitting here. It's Linda, all capital letters, Linda, all capital letters, and then 50. Linda 50. Would you mind getting some, do you want to bring some samples in? And maybe if anybody else has some samples, because we're going to be wrapping up in just a few minutes. Yeah, thank you. So if you didn't get any samples, then we'll have them bring in some for you. So using Linda 50 will get you 50% off with OSAP. Every January, OSAP has an infection control boot camp that is an unbelievable experience. You've missed the early bird deadline for January this, 2020. Plus, it's going to be in Chicago. But you might like the cold weather. I don't know. So there's going to be in cold weather, but just a great place to apply. Okay. So when we wrap up in a couple minutes, what did I talk to you about when you take samples of products and you change to a new disinfectant product from cleaning and disinfecting? What do? Sip of water. Yay! They were so wide awake now. They're getting kind of tired now. Okay. So we talked about the case law examples and how there's some precedents in dentistry and why we have our reinvigorated system for our infection control principles, right? Okay. So when we wrap up, what I'd like you to do is, because we are finishing early, which is a good thing. I'm happy for you on that. If you felt like we didn't go through your questions, I'm happy to stay after. I didn't see people raise hands. We did ask for questions. So let's finish your course evaluation, and then I want you to do me a favor and pick up some supplies out there. Erica did it again. Erica has some stuff down here, but let's do your course evaluation. And if you have a license, do not leave here without a pink slip, all right? Because this way you can have control over doing it and getting it down again. So I'll open these up. And if you didn't do the code, get the picture. Doctors, I invite you to come down and take a book back for your practice. So for our doctors that are here. Yep. Yeah, you want to pass it around? Yeah.
Yes.
Thank you. All right. Thank you.
I'll take 2.
Okay. There we go. Thanks. All right. You know what? I'm going to put these on the table so you can come and get what you want, okay? Here. Those have the QR code on them. Yeah, but these don't. No, fine. I'm sorry. Yeah. Here. There. Pass these around. Okay.
Not pharmaceutical waste.